Pranjit, mute है तुझा speaker.
Ma'am, we are live now.
We are live. Okay. Yes. Can we have the PPT?
Yes, sir. Is it visible?
Yes. One minute. Yeah. थोड़ा technical glitch होता. He's starting within 1 minute. Slides were not running. We are live. Okay. We can see the slides.
सुनीता मला वाटतं स्टार्ट करा.
नाही त्याच्या बाजूनी स्लाइड्स रन होत नव्हत्या सुयोगा.
ओके ओके
So,
ओके ओके
हा तर तो
Now we can
तेच
start.
हो नाही प्लीज यू स्टार्ट बाय इंट्रोडक्शन. प्रांजल.
सुदेश सर वेलकम.
थँक्यू. 4 वाजता थोडा अवघड होतो, संपत नाही का 6 नंतर बरं पडतं.
पुढच्या वेळेस सर.
Good evening, everyone. I am welcoming you all on IMA MS WDW in association with Amogs, TAC and Amogs Medical Legal Committee brings you the Life Beyond Medicine Part 4, कायदेशीर सरोकार. Cordially invite you for Core Connect live webinar, कायदेशीर सरोकार. So I welcome Dr. Sunita Kedkar ma'am, who is a consultant and director Kedkar Maternity Hospital, Aurangabad since last 16 years. She's the cultural secretary of AOGC, AOGS from 2024 to 2025. She's a youth coordinator for Amogs in the year of 2022, 2024. And she's the member of Aesthetic and Sexual Medicine Committee, Amogs.
Thank you, sir.
2024.
Thank
So,
you.
welcome, ma'am.
That should be nice. Hello.
You can see the slides. Hello.
Yes.
Yes.
Yes. Thank you for the kind introduction. Uh,
welcome.
4 वाजता थोडा अवघड होतो, संपत नाही का 6 नंतर बरं पडतं.
बॅक कसं जात आहे सगळं रेकॉर्डिंग.
हा प्रांजल.
Yes, ma'am.
बॅक रेकॉर्डिंग ऐकू येतंय. ओव्हरलॅप होईल सगळा प्रोग्राम.
Just a minute.
Just check it or otherwise we'll restart it.
Just give me 1 minute now. Medical Legal Committee brings you
Okay, ma'am, welcome.
कायदेशीर
Welcome, madam.
Hi, thank you so much invitation.
Good afternoon, madam.
Good afternoon, sir. Welcome, sir.
Hello, Swapnanjali.
मॅम आता नाही येणार आवाज.
Hello, ma'am. Pranjal, it is done.
Yes, ma'am, yes.
You want to restart the YouTube?
We can start with, I already introduced Dr. Sunita, so we can start.
Yes,
Yes.
yes,
Dr. Sunita.
Sunita, over to you.
yes, yes, yes. Good evening, all. On behalf of IMA MSW, MSWDW, Amogs Public Awareness Committee, Amogs Medical Legal Committee, we would like to welcome you all for this webinar on Life Beyond Medicine Part 4, Kaideshi Salokha. For this interesting webinar, we have two eminent conveners, Dr. Suyoga Panat and Dr. Revati Rani. Before that, we would like to have auspicious lamp lightning. Can we have the video of lamp lightning?
Pranjal? Next slide.
मॅम होत आहे.
Okay. Pranjal, I guess network issue आहे कारण ऑडिओ येत नाहीये तिथून. Just check it once. If the slides are not running, आम्ही कोणीतरी प्ले करू शकतो. Let us know.
Sorry, ma'am.
Hello? प्रांजल, आवाज नाही येत आहे.
तिकडच्या आवाजाचा issue last time also what he was saying not clear.
Okay, we will pray the God silently, I
Just
guess.
Yes.
इकडे ऍक्च्युली खूप जोरात पाऊस आणि ते सगळं चाललंय त्यामुळे नेटवर्कला इश्यू येतोय.
Let us know, we can play
Yeah,
it if you.
just
I guess slides चा problem
Yes.
नाही येणार. हा.
हो
ऑडिओचा
गया
असेल.
ना? Audio. सुनो जाओ वहाँ पे सोनोग्राफी करने.
I request all participants to please mute their audios if they're not addressing anything.
So shall we move ahead?
महाकाय सूर्यकोटि समप्रभ निर्विघ्नं
I guess we have received enough blessings.
Blessings,
निर्विघ्न
yes.
थोडंसं विघ्न आलेलं आहे, but with that,
We'll
yeah,
move
we-
ahead.
निर्विघ्नपणे पार पडेल. Yes, yes. We'll move ahead, I guess. Pranjal, you can have the next slide, please.
With that prayer,
गुरु मे
with that prayer to Lord Ganesha, we'll move ahead. I would like to introduce conveners for today's program. Dr. Revati Rane, can we have CV? She is dynamic personality, director of 100 hospital, and she runs scientific unit for more than 11 years. She is the first life center named Akluz Fertility and Test Tube Baby Center since last 5 years. She is chairman of State IMA Women's Doctors Wing 2024, Amogs Public Awareness Committee chairperson. She has held
Thank you, ma'am.
various
Thank
posts
you,
at
thank you.
Akluz OBGYN Society.
Thank you, Sunita. Thank you.
With that, we have to Dr. Revati Rani. Can we have CV? She is dynamic personality, director of 100 hospital, Yes, welcome Revati.
Yeah, thank you.
Dr. Revati.
So, yeah,
I
on
will
behalf,
request Dr. Revati to.
yeah. Am I audible clearly?
Yes,
I'm,
yes.
yeah, because I
Yes,
can hear a
yes.
lot of voice disturbances. Yeah. So on behalf of IMA, WTW and Amogs, I welcome you all. I welcome all the Amogs and IMA office bearers, all eminent faculty members who have joined here, and all dear delegates who have joined for today's webinar. Today I'm welcoming you to part 4 of Life Beyond Medicine. Medicine, I feel, is not just a science, but it's an art. And we have to understand it and to live life fully, we have to use all the crayons in the box. So we started with financial health, then we, had a webinar on physical health, mental health, and today we are going to discuss something which we all fear from our core, that is legal health or the legal aspect. I must say that as law is one of the great healing professions, while medicine heals body and the mind, law heals the social ribs. And we all try to, आपण म्हणतो कोर्टाची पायरी नाही चढायची. We try to stay away from law, but I feel if there were no bad people, there would be no good lawyers. And we have so many medical legal experts with us, and that is why we have opted to go with legal health for doctors today. And at the outset, I really want to thank Suyoga to get associated with this. She is a Amogs Medical Legal Committee chairperson, and thanks to Sunita to be being the MOC of this event. And thank you once again. I request all of you to be very attentive and towards this webinar. And thank you.
Thank you, Dr. Revati. We would like to invite our second convener for today. Can we have Dr. Suyoga? She is consultant obstetrician and gynecologist. She has done fellowship in advanced ART, past president of Amravati OBGY Society. She is chairperson of Amogs Medical Legal Committee, West Zone coordinator for Ethics and Medical Legal Committee,
Thank you,
FOXI.
Sunita.
She is recipient of multiple awards.
Thank you, thank you.
Yes.
Thank you for your kind introduction.
Welcome, Dr. Suyoga.
At the outset, I would like to thank Revati to be associated with me for this series of Life Beyond Medicine, and I know all the parts of this episode of this Life Beyond Medicine were very good, very well appreciated by one and all. So, a very good evening to all the respected IMA as well as Amogs office bearers, especially Dr. Dinesh Thakre sir, our chief guest, and Dr. Kiran Kursakoti sir, Amogs president, as well as our guest of honor, Dr. Bipin Pandit sir, and Dr. Ajay Mane sir, all the honorable seniors and faculty members, chairpersons, delegates, and friends. At the outset, I would like to say that medicine is a profession in which the more you know, the more you realize that you don't know. So, I'm privileged to conduct this webinar, Kaideshi Saloka, along with the wing of IMA, the WDW wing of IMA Maharashtra and PAC committee of Amogs. As we all know, in December 2023, President Draupadi Murmu granted her assent to the Bharatiya Nyaya Samhita, Bharatiya Nagrik Suraksha Samhita, and Bharatiya Saksha Adhiniyam. These enactments, they were set and they were supposed to replace they are supposed to replace the Indian Penal Code, that is the IPC, the Code of Criminal Procedures, that is the CRPC, and the Indian Evidence Act. And we should be aware of about the specific provisions and the legal framework which is applied to that. And that is why we have included this topic of understanding the BNS, which will be delivered by none other than Dr. Dilip Parke sir. We have other stalwarts from the medical legal field, that is Dr. Jayant Naurange sir, as well as Dr. Ashok Shukla sir, to deliver their talks on communication and ethical advertising. So I think also we have Advocate Amit Karkhane sir, who has an experience of almost 20 years in the medical legal field to guide us on the various dilemmas of the medical legal issues. And we have esteemed panelists for the same. We have great chairpersons who are also very good in the medical legal field and who have vast experience like Dr. Girish Kumtekar sir, as well as Dr. Sudesh Doshi sir, Alka Puthe madam, and all the other chairpersons. So I think I also request all the delegates to keep their questions ready for the speakers as well as Advocate Karkhane sir, because I don't think we will get another platform where we will have all the experts under one roof. So thank you very much, and over to you, Sunita, for the further session.
Thank you, Suyoga ma'am. Now I'll request Dr. Revati to introduce our chief guest.
Can we have the slide, please? Yes. So today we are honored to have two chief guests here. Both are president of respected fraternity. Dr. Dinesh Thakre sir is president IMAMS and Kiran Kurtakoti sir is president Amogs. Can I have the next slide, please? So our first chief guest, it's my honor to introduce Dr. Dinesh Thakre sir. He is president IMAMS. He is pathologist and LLB himself. He has done international certificate in UNESCO bioethics. Has done MA in journalism and mass communication, MBA in general management, and BA in English literature. You can see his CV is vast, but here we can see that he has been co-chairman of IMA Medical Legal Cell and also been treasurer to Indian Medical Legal and Ethics Association. So it's really, it's an honor to have you, sir, here, and we are looking forward to your guidance. Over to you, sir.
Thank you, Revati madam. Am I audible?
Yes, sir.
Yes, sir.
Clearly,
Yes, very good.
please.
So, as usual, as always, you have chosen a very good topic.
Thank
As
you,
you are
sir.
saying about mental health and now legal health. I am now waiting for the fifth, and I am just thinking what could be the fifth topic. So I am sure that it will be again a surprise and a good topic. Today's topic is Kaidashi Saloka, and which I always like, being a medical legal, working in a medical legal field. And I am especially happy to see Suyoga there today. She is my just friend and from my place. I am proud to see her here. And I think Dr. Kiran sir is joining later. We have a guest of honors, Dr. Saroj Sanjanwala, State Secretary, Dr. Santosh Kadam, State President-elect, Dr. Vikrant Desai, State Treasurer, along with respected Dr. Bipin Pandit sir, Dr. Ramaya, and Dr. Ajay Mane sir. And I can say that today we will be having a medical legal feast. Usually we say academic feast. Today, because the speakers are so experts. Dr. Jain Naurange sir is my mentor in medical legal field, and we will be listening especially on communications. And Dr. Dilip Parke is another such a tall personality. It is always loving to hear him. And Dr. Ashok Shukla, my friend, he has been the chairman of State Medical Legal Committee for 2 years, and we work very good for 2 years. The best part I can see is today Kat Ghare Mein, and that will be all asking to Dr. Advocate Amit Karkhanis about all the issues on medical legal issues regarding medical legal things. I especially appeal the delegates to be specially ready for this panel discussion and get your all questions asked from resolved from Advocate Amit. So all the best again, Dr. Revati madam and Suyoga, and I am awaiting again after this for the fifth session, which will be surely beautiful, like all these four. Thank you very much.
Thank you, sir. Thank you once again. Thank you for always encouraging and supporting us and always being here for us for this Life Beyond Medicine platform. Thank you once again. Next, we have our chief guest, Dr. Kiran Kurtakoti, sir. Sir is right now in an emergency, so he'll be joining later. Ranjit? Sir, he is President Amogs 2024-26, and sir has been chairperson of MTP Committee Foxy and Amogs. So he is also closely associated with MTP and laws. He will join later and guide us later. So over to you, Sunita, for further proceeding.
Thank you, Dr. Revati. Now I'll request Dr. Suyoga to introduce our guest of honor for today.
Can we have the next slide? Yeah, we have Dr. Bipin Pandit sir, Honorary Secretary, Amogs, as well as Dr. Ame Purandare sir, Senior Vice President Amogs, Dr. Ajay Mane sir, VP Foxy, and State Coordinator Amogs, as well as Medical Legal Expert from our BGY field from the Amogs as the guest of honor, and I have the privilege to introduce them. So can you put the next slide? Yeah. Dr. Bipin Pandit sir. Welcome, sir. Sir is the Secretary Amogs, past Executive Council member of Maharashtra Medical Council, Vice President Foxy, 21-22, past President of MOGS in 1890, past Joint Secretary Foxy 2015, and Treasurer AICOG 2013 Mumbai.
Thank you.
Yes,
I think we should waste too much time in introduction. Thank you. I think we should not waste too much time in introduction. Everybody knows everybody here. Our President, Dr. Kiran Kursakoti. I am a President, Dr. Dinesh Thakre. My other two guest of honors, Amaya, Mane, Sanjanwala, Dr. Santosh Kadam, and Dr. Vikram. And all the esteemed faculty like Dr. Navlaki, Dr. Dilip Walke, Dr. Ame Purandare, and all the chairpersons. It's a great pleasure to be with you here. Medical legal problem. This word was totally unheard of when I started practice 40 years back. Today it has become common. I think every conference or webinar, we must have one section on medical legal awareness and to educate our people about what's happening around us and how to tackle these problems. We all keep practicing doctors that this is something which will not never happen to me. This is happening to my neighbor doctor or somebody else, which is not true. Today it is somebody else's number, tomorrow it might be, including medical legal cases and violence. I'm sure today's experts will educate us, and this is a great piece of knowledge, especially communication, ethics, and Gadgareme. So I wish all the best, and I'm thank Revati and Suyoga for choosing excellent topics and very good topic for the panel discussion. Thank you very much for giving me opportunity. God bless you all.
Thank you, sir. Thank you so much. Thank you. Yes.
Next slide, please.
Next slide. Dr. Amir Purandare, sir. He is right now he has not joined due to some unavoidable reason. But I will introduce him anyway. He's consultant obstetrician and gynecologist, Purandare Hospital, KJ Somaiya Medical College, and Sir HN Reliance, Bhatia Masina, Mumbai Police Hospital, Senior Vice President, Amogs 24-26, and Joint Secretary, Foxy 2019, Chairperson, Food and Drugs Medical Surgical Equipment Committee, Foxy 15-17, and Assistant Administrator, Foxy Manyata Project on Quality Care in Safe Childbirth. Since Sir is not here, I would ask Pranjal to play the next slide. Dr. Ajay Mane, sir. Ajay Mane sir कोड नाही ओळखत. So, but I would have the privilege to introduce him formally. Sir is Vice President Foxy, West Zone 24-25, past President Aurangabad OBGY Society, past Joint Secretary Amogs, and past Chairperson Amogs Adolescent Health Committee.
बस
सर तुमच्याकडून आशीर्वाद.
अरे आशीर्वाद नाही, शुभेच्छा. चलो, good afternoon all. Today this is part 4 of Life Beyond Medicine, and I am AMS Women Doctors Wing in association with the Amogs. PAC committee and Amogs Medical Legal Committee brings you Kaideshi Saloka. Basically, see, we are in a era of Consumer Protection Act and criminal negligence and litigations and all the things, very bad things going on in our field. म्हणून आपल्याला बेसिकली कायद्याचं ज्ञान असणं अत्यंत जरुरी आहे. इग्नोरन्स इज नेव्हर ऍक्सेप्टेड इन द कोर्ट ऑफ लॉ. म्हणजे मला माहित नव्हतं, नो, यू मस्ट नो. असं त्यांनी गृहीत धरलेलं आहे की तुम्ही इकडे आला तर तुम्हाला माहिती पाहिजे, नाही तुम्ही येऊ नका. ते म्हणतात तुम्हाला निमंत्रण दिलं होतं का? नाही. मग आपण आलो की नाही, मग आपल्याला सगळं माहिती पाहिजे. तरी पण आपल्याला माहित नसतं. देन मग आता हे सुयोगासारखे किंवा रेवती सारखे आणि त्यासोबत सुनीता, हे जे लोक आहेत ना, हे आम्हाला कायद्याचं जागर चालू ठेवतात आणि आम्ही सगळे आहोतच ना मग त्यांना मदत करायला. त्यासाठी यांनी इतके छान वेबिनार ठेवलेले. एव्हरीबडी हॅज स्पोकन अबाउट द टॉपिक, सो आय एम नॉट गोइंग टू स्पीक अबाउट द टॉपिक्स. सो रिस्पेक्टेड दिनेश ठाकरे सर, हु इज द प्रेसिडेंट IMA, respected Kiran Bhau, who is the president of our Amogs, then respected Bipin sir, who is the secretary, Ameya, my younger brother, who is the senior vice president in Amogs, then Dr. Saurabh sir, honorary secretary, IMA, then Dr. Santosh sir, president elect IMA, and Dr. Vikrant, honorary treasurer IMA, and our beautiful MOC, Dr. Sundar Khadkar from my own place, Aurangabad. And these three ladies are most active ladies in Amogs, I think. Sunita, Revati, and Suyoga. Obviously, Revati and Suyoga and Sunita, they are contemporary. Somebody maybe senior to, but by work, they all are equal. They all are working very hard. So best luck to them for their incoming endeavors, all in Amogs and in Foxy also. The sessions, and obviously the speakers are very nice today. Jayant Davange sir, Dilip Walke sir, Ashok Shukla sir, and our elder brother in field of legalities, अमित कारखानीस, ज्याच्याकडे आपण काही अडलं की ज्याच्या तोंडाकडे बघतो, असं आपण मराठीत म्हणे की नाही माझ्या तोंडाकडे बघा, तर तसं तर आम्ही बघतो अमित भाऊ आता काय करायचं सांग. अमित भाऊ आपल्या इमानदारीने आम्हाला सगळ्यांना सल्ले देतो. द बेस्ट पर्सन इन लिगल थिंग फ्रॉम आवर. मग आपण त्यांना प्रश्न विचारू. मग कडघरे मी खूप छान, ते अमरावतीने ते धरूनच ठेवलंय कडघरे मी. आता मला वाटतं त्यांचा बहुतेक हा 5वा-6वा कार्यक्रम असेल. अँड ऑब्विसली द चेअरपर्सन सुप्रिया, कांचन, उज्ज्वला, गिरीश सर, वर्षा, Swapnanjali. Swapnanjali is a teacher in Nashik Police Academy. I must endorse her work in the police academy. ती 150-200 पोलीस इन्स्पेक्टर जे अधिकारी तिथं ट्रेनिंग घेतात त्या लोकांना हाऊ टू इम्प्लिमेंट द लॉज, PCPNDT, MTP, पॉक्सो, रेप केसेस, हे सगळं शिकवती छानपैकी. सो वी मस्ट अप्रिशिएट हर वर्क. देन अलका मॅम, सुदेश सर, and Monica from Solapur. All the personalities, they are doing good work. Dr. Vandana, Dr. Asha, Dr. Prajakta, Dr. Kavita, Dr. Sarupa, and Dr. Saili from Amravati. They will be asking the question to the Amit Karkare. खूप छान program आहे, very beautiful. Everybody should take advantage of this, and I must appreciate the logos which are given above. First is Indian Medical Association, वर ज्योत जळती ज्ञानाची, आणि खालून त्याला मेडिसिन्स लावलेले आहेत, बाजूला आपली फांदे आहेत छानपैकी. विमेन्स डॉक्टर्स विंग इज व्हेरी नाईस टू विमेन. दे आर डान्सिंग विथ द स्टेथोस्कोप. मीन्स ज्ञान आणि एन्जॉयमेंट ऑफ द लाईफ दे आर हॅव्हिंग टुगेदर. तिसरा लोगो आपला अमॉगचा आहे. पूर्ण महाराष्ट्र त्या बाईच्या मागे उभा आहे असं त्याचं प्रतीत होतं. इतकं सुंदर लोगो आहे तो. आणि नंतर आहे जागर स्त्री शक्तीचा. ती जी स्त्रीमध्ये दाखवलेली आहे. शी इज टेकिंग केअर ऑफ द बेबी अँड वी ऑल आर सराउंडिंग विथ द कलरफुल हँड्स. आपण तिची काळजी घेतोय आणि तिच्या स्वप्नांना पंख लावलेले आहेत. नरेश तू राष्ट्रस्य स्रोहा, इतकं छान दिलेलं आहे ते. आणि शेवटचा जो लोगो आहे तो मध्यभागी आहे, तो आहे IMAचा, आओ गाव चले. आता माझे काही आगाऊ मित्र आहेत, त्या मित्रांनी आओ गोवा चले असं वाचलं ते, आणि मला सांगितले की चला गोवा. गमतीचा भागा सोडून द्या, पण इतके छान लोगो हा तुमचं व्यक्तिमत्व, तुमच्या असोसिएशनचं व्यक्तिमत्व दर्शवतो. आणि त्यानुसार हे सगळे इतके परिपक्व लोगो आहेत की मला हे अप्रिशिएटच करावंच वाटलं, म्हणून मी आज त्याच्याबद्दल बोललो. परत एकदा सुनीता as a MOC, Revati and Suyoga as the chairpersons of PAC committee and medical committee, I congratulate you and I convey best of luck from my side for not only this session, for all the above coming and all sessions in Amogs and Foxy also. So best luck.
Thank you, sir.
Thank you, sir. Thank you for the kind words. Thank you so much. Over to you, Revati.
Yes, next guest of honors, we have Dr. Saurabh Sanjanwala sir. Sir is currently busy, but he's a general surgeon and laparoscopic surgeon from Mumbai and also male infertility specialist. We can see he has held many important posts in IMA, but he is always helpful whenever we call him regarding anything for as a speaker or for any guidance. He's always there to pick up a call at any point of time in any point of day. So thank you, sir. We hope that he joins when he gets free. Next slide, please. Next guest of honor, we have Dr. Santosh Kadam, sir, who is a pediatrician and neonatologist from Thane. He is president-elect IMA Maharashtra set, and also we can see he has held many eminent post in IMA. Next slide. So this is something very important. No, back please, Ranjit. Yeah. So he has worked on various committees, drafted committee, Maharashtra CA, ethical committee, MMC, medical legal committee. So I hope he gets free and joins soon and we can get some guidance from him. Next slide. Dr. Vikrant Desai, sir, I just contacted him. He is not in the coverage area right now, is not able to join, but he's treasurer of IMA State Maharashtra, and I hope he also joins soon. So with any further delay, we'll start with the first session. Over to you, Sunita. Next slide, please. Over to you, Sunita.
All the blessings from scholars. Let's move ahead to the academic session. Hello.
Yes, we can hear you. We can hear you. We can start.
Yes. Let's move to the academic session. For the first session, I'd like to invite the chairpersons, Dr. Alka Kuthe ma'am, Dr. Sudesh Doshi sir, and Dr. Monica Umbardan. I'd like to introduce our chairpersons. Can we have the CVs, please? Next slide. Alka Kuthe ma'am is consultant gynecologist and medical legal expert. She chairman of IMS 2020-24, National Coordinator for Foxy Ethics and Medical Legal Committee. She is founder member and National Secretary of Human Milk Banking Association of India. Welcome, ma'am. Our second chairperson is Dr. Sudesh Doshi, sir. Sudesh Doshi, sir, is consultant obstetrician gynecologist. He is working since last 28 years in rural hospital at Pandharpur. Experience of delivering more than 70,000 babies at his own nursing home. Chairperson of Adolescent Health Committee. He is member of NIMC PCPNDT Foxy, President of Pandharpur OBGYN Society, Vice President of IMLEA Maharashtra Chapter. Welcome, sir. We'd like to invite Dr. Monica Umbardan, ma'am. She's consultant obstetrician and gynecologist, Amogs Zonal Coordinator, Public Awareness Committee Chairperson Amogs for the year 2022-24, Website Coordinator for Amogs 2018 to 2020. She was Youth Coordinator Amogs in the year 2022 to 24. Executive Member of Public Awareness Committee, Executive Member of ISOPAB, Treasurer of IMA. Welcome, Dr. Monica. Since Dr. Monica has to leave early, we'll request her to kindly introduce our speaker, Dr. Jayant Naurange, sir. Next slide. Dr. Monica, kindly introduce.
Yeah. Hello, Monica, ma'am.
Monica, are you there?
Well, if Monica is not there, I will do the
Sir.
honors. May I?
Yes, sir. Please.
Yes, yes.
Yeah. It is a great honor to introduce someone like Dr. Jayant Naurange, whom we look up as the Bhishmacharya of the medical legal things. Though he is not a gynecologist, but being a pediatrician from Pune, and I know him so many years when I was an undergraduate student, postgraduate student. He has been guiding us all when the concept like something a medical legal consultant was not there. Dr. Jayant Naurange was one of the pioneers in this field, guiding us through all these fields. Is being a gold medalist at MBBS, GCH, and MD. He's a ranker in the LLB also. He's been honorary pediatrician at so many places. He's past president IMA, vice chairman medical legal cell, visiting faculty as ILS Law College, and not only doing medicine and law. He's a great sport enthusiastic, completing for 26 half marathons and full marathons. And has been recipient of Bertha Holt International Award for rehabilitation of more than 10,000 family deprived children in the last 40 years in USA. He has been chairman of IMA Medical Legal Maharashtra State's Social Security Scheme from 2018 till now. And I welcome you, Dr. Jain, and I would like to say a few things before you start. Topic given to me is very apt and very dear to me, communication skills. I as well as always say that in medical colleges, many times we are just taught about medical skills, but we lack in communication skills. And that is the basic root of so many legislative problems of medical legal problems. The litigations come because we fail to communicate the patient. मला रिपोर्ट बघितला आणि मी सांगितलं की त्याला सगळं, but you are not communicated the report in proper way to him. There is where the basic cause of so many litigations. So to avoid litigations, you have to sharpen your communication skills. And Dr. Jayant is the best person to talk about this. To you, sir, please.
Thank you so much, Dr. Sudesh. And at the outset, I won't remember all the names, but I'm giving all the great thanks to the organizers, Amogs, as well as IMA Maharashtra State. And I recognize the presence of so many respected dignitaries, Dr. Thackeray, Dr. Sanjay Mala, yourself. Revati was the person who was expressly involved in calling me over here. Dr. Alka Kute is doing a great work in conducting the weekly programs. And all of those, and Dr. Bipin is also there, all of them are my friends. And you, as usual, I am the opening batsman here too. So with this, I think there was a little mistake in the spelling of the title, that communication and legislative, it should be legal issues. So with this, I will start with my slide presentation. Can you just host disable the participant screen sharing? So can you just make me host and so that I can share the screen?
Pranjal?
So you can share the screen, sir. So you can share the screen.
I can, okay. Yes, I can.
Your both also, sir.
So I think it's visible now?
Yeah, it's totally visible, sir.
Dr. Walke is also there, a good and great friend of mine from Pune, and Dr. Girish Kumtekar from Solapur. So it's a great galaxy of speakers, and I'm just a beginner. So right in the beginning, I must say that I salute all the doctors. See, today we are talking to each other from various corners of Maharashtra state, and that's possible because of technology. The same thing is true about medical field and the technology, and it's only because of the developments in the respective fields that more and more complicated and lengthy procedures, lengthy surgeries, diagnostics, and therapeutics are possible with the good patient safety. But this is the same reason that there are more and more complex issues. So out of this, we will see what are the real reasons of so much increasing litigations in a geometrical proportion and what is the real solution to that in a nutshell. So there are many responsibilities like checking consent, blood, medicines being administered to the patient, identification, invasive procedures. This is all medical. But apart from that, we are involved in so many administrative capacities also. And as I think Sunita has mentioned, that you cannot escape from saying that I did not know about this. We have to be omnipotent. I mean, you have to be expert in one field, but then you have to be omnipotent, master of all, not just jack of all and master of none. It's master of all. We follow the medical ethical principles. Of course, whatever I'm saying, I know and understand very consciously that whatever we are saying just now is easier said than done. Practice is little different. But then if we try to be holding to these principles and footings, very likely, I cannot assure you that nothing will happen, but if at all it happens, we will come out clean. Very important principles of medical ethics are do no harm. So cure whenever possible, care always, but no harm anytime. So that is the first principle in medical ethics. Second is we have to follow eternal vigilance. Eternal vigilance on the surroundings and on the concentrate on the patient's health. What other people are doing, what's surrounding, and what is the ecology of that particular setting. Patient autonomy means previously, particularly my generation, so maybe up to the year 2000, the doctors always used to say, if any questions are asked more than one or two, they would say to the patient, do you understand more or I understand you better? So don't ask me any questions. So that was the thing. Today, patient has become the partner in his own management. We are the people to give him the expert guidance. So in short, the decision to undergo surgery, even if it is life-threatening or life-saving, we are there to give us a guided opinion. And if he doesn't agree, you can just toss him to another hospital, or you can call in more and more opinion, or you can send him to a government hospital, but you cannot enforce your desired treatment on him. That is patient autonomy. So that we have to inculcate. Indian doctors are not tuned to this as yet. And this is one of the conflicting issues, that patient autonomy, even if it is going to cost his life, we have to give him the advice and try to persuade him, but cannot force that particular treatment or modality on him. Then last is confidentiality. So these some of the important features of medical ethics in a nutshell. And then we will see where are we all answerable. We are all answerable to various forums, various commissions. We are answerable not only at one place at a time, it can be simultaneously forced upon us, or maybe one after the other. So where are we answerable? Respective medical council. So we are answerable to the state medical council. In Maharashtra, it is Maharashtra Medical Council. Then we are answerable to the civil courts, or the offshoot of that, that is a consumer court, or what now is called as consumer commission. Previously, till 2023, it used to be called forum. And that comes under law of tort, that is civil law. Third forum we are answerable is a criminal action. That means Indian Penal Code, now it is called as Bharatiya Nyaya Samhita and CRPC and Bharatiya Saksha Samhita and all that. But basically it is the same old wine in the new bottle, basically. Next is we are also answerable to the Human Rights Commission. But as of now, it's not applicable to the private practitioners. Right to information, not applicable to the private practitioners, but those who are running the trust hospitals. And when there is a substantial help from the government or subsidy, RTI comes in. Statutory bodies like municipal corporation, Maharashtra state or any other state, I'm sorry for the wrong spelling, and central government. So these bodies are also, to them we are answerable, because they are the ones who give us the permission to practice, permission to run a clinic, permission to run the hospital. Then there are specific laws like biomedical waste disposal rules. And for gynecologists, it's easier to know MTP, POXO, tuberculosis, so many special laws are there. And the POXO is, of course, encompassing even the general practitioners. And last but not the least, of which we are all afraid, and what has happened in Kolkata and all across the country, for which yesterday we had hearing. We are, by the way, we are proud to say that we are directly pleading in the Supreme Court. So yesterday we were given 6.5 minutes, which is supposed to be quite big. I think Advocate Amit Karkhanis would agree that consecutively, without any interruption from the Chief Justice of India, we could argue for 6.5 minutes was a big achievement regarding anti-violence law. So that is what I'm meaning by Janata Darbar. Now, why these problems are coming up in a great way, and what is the real solution? Indian economy has become global economy. We are fifth largest economy in the world. All citizens of these countries, all trades, all businesses, and all professions and vocations, including the doctors, will face greater and newer challenges. There is aggressive consumerism, explosive media. You know, there are more media trials than court trials, cutthroat and unfair competition. I cannot compete with a big corporate hospital. And the government sector cannot compete with the big corporate sector, and corporate cannot compete with the small village hospital, and so on and so forth. So every situation is different. This country is unity in variability and variety. So the problems are very many. Increasing costs. Why the costs are increasing? Because of technology. Newer the technologies, newer the drugs, newer the vaccines, they are more expensive because there is a problem of Patent Act. It is very easy comparatively and very comfortable for the patient. So what has happened is expectations have gone up because of aggressive consumerism. People want 7-star treatment in a 7-star hospital, but are not mentally prepared to pay to that extent. And the medical education has become very expensive. Everything is privatized. Even in government college, the fees are too high. And that's why production of a doctor is so expensive. Similarly, it takes a long time. And therefore, ultimately, the cost has to be recovered from the patients. And information explosion is causing increasing heightened expectations. Now, what is the real answer to this? Answer to this is vibrant patient-doctor relationship. Doctor-patient relationship is the single most important factor. And that is at its lowest ebb at this moment because of the above mentioned factors like global, increasing cost, aggressive consumerism, explosive media, cutthroat and unfair competition, and information explosion. Second important factor that we should keep patience. Not only patient is supposed to keep patience, we should be patient. In communication, I will put it in a nutshell that keep ice bag on your head and sweet pill on your tongue. That is the principles of communication. Consumer is right, client is right, but not so much to the extent of ordinary trade. We are professionals, and therefore sometimes we tell the truthful, bitter things also, but that has to be told tactfully. Persistence. So persist to your principles and ethics and good communication. So I will concentrate upon that in the last few slides. So mannerism. आता काय झालंय सोसायटीमध्ये? You see the Badlapur incidents. You see the things were horrible, no doubt, but extreme tapatpana to take the things in the hands, no tolerance whatsoever of any sort, even within the family. And that is what I mean to say, that we have to imbibe in our next generation the gentle behavior, upright and pure-hearted behavior in your profession, and also explain to the patient, to each and every patient today, particularly in cities, whether tier 2 city, tier 3 city, whatever, they are bubbling with Google. So for that, you must put this board in your clinic or hospital that please remember, all these search engines give information. However, information is not equivalent to knowledge, and that in turn is not equivalent to the experience. Information, knowledge, and experience together cook into the wisdom. What is the basic virtue of a good doctor? So please remember, patients should be made to understand that what you are giving me is information. This is not equivalent to knowledge and definitely not equivalent to experience. And all these three together concoct into the wisdom of a doctor. So this apart, I will go straightway quickly to the further slides, otherwise time will be short. And one important thing which to all my new doctors I will say, which is not taught in the medical colleges, is that every patient coming to you in history point, ask what is the history of allergy and are you on any chronic medication. Every person nowadays is on chronic medication. Either it could be aspirin, it could be clopidogrel, it could be anti-rheumatic medicine, it could be steroid, it can be so many other things. So please ask about this history, because that is going to have a big burden on the patient's outcome if you're tackling the patient without asking this history. So I think I will skip this point of civil and criminal negligence and all this, because that's a separate topic by itself. But just to give in the simpler language what is meant by medical negligence is mentioned in the first case decided by the Independent Supreme Court of India in 1969. In the case Dr. L.B. Joshi versus Dr. Tambak Bapu Godbole, both are from Pune, and this hospital is still running under the name of Maharashtra Medical Foundation Joshi Hospital on a very prime locality and a very good hospital. So this Dr. Joshi lost that particular case, but the principles laid down by the Honorable Supreme Court are quoted in each and every case of related to the doctor's cases, that is medical negligence cases. And what does it say? A person who holds himself ready to give medical advice and treatment impliedly undertakes. So when I say I'm a doctor, impliedly I say that I possess the necessary skill and knowledge. The knowledge, how do you judge? It is by your degree. And the degree has to come from MBBS, MD, MS, whatever it is, has to come from a recognized college. Who gives the recognition? It used to be MC and now it is an MC. So it has to be recognized college of a recognized university. Now in Maharashtra it is MUHS. At my time it was Pune University, Bombay University, like that. So we have to possess that knowledge. And skill means that is authorization and certification by MMC. So registration and updated registration every 5 years is the rule of this land. So we have to get skill certified by your registering body, that is Maharashtra Medical Council. Such a person is supposed to have this. If it is not there, he is primarily negligent. Okay, we go ahead. So he has 3 duties. What are these? A duty of care in deciding whether to undertake the case. So in short, doctor has the freedom to choose the case or he can refuse the case. When I say he or she, either. Number 2, a duty of care in deciding the treatment. मी काय औषध देणार आहे, काय ट्रीटमेंट मोडॅलिटी देणार आहे, काय सर्जरी करणार आहे. I have to decide that. That means I have to come to a pinpoint diagnosis or at least a working diagnosis. And that in turn will depend upon a good history taking, proper physical and clinical examination, appropriate investigations, and then coming to a working diagnosis, and then if required second opinion and so on and so forth. And then what treatment do we give? And lastly, how to administer that treatment with the help of yourself and your assistants, juniors, housemen, nurses, ward boys, ayas. So you require so many people to implement that treatment, particularly in a hospital setup. Any breach of any of these 3 duties, that means in deciding treatment or choosing the patient or administering the treatment, is actionable negligence. So this is in a nutshell what is meant by negligence. And the last sentence is important. What is important is care and not cure is expected by law. What is expected by law is proper care in the given situation to the best of your ability. It need not be the supermost. It need not be the super specialist treatment. More the degree you claim, more the specialization you claim, more is expected by law. But what law basically requires is that we cannot we are not expected to give any assurance of cure. That itself is illegal. It is unethical. What is expected is care. So I will skip some of the slides. So some of the things when the results go wrong, everything going wrong in the patient's condition is not negligence. So some of the examples are, it appears like a negligence, but difference of opinion is not negligence. Wrong result despite careful treatment is not negligence. One of the 2 standard lines of treatment are followed, not negligence. New medicines or therapy given after full formalities. Explaining, see, desperate situation, you are giving a research medicine, research molecule. Even if it is not approved for that particular use, is acceptable. Patient's non-satisfaction is not negligence. No relief despite proper treatment is not negligence. Taking longer time to heal, it is ultimately the body's response. So you cannot assure that in 3 days it will be cured and 5 days it will be cured. It is not possible. Not taking consent in an emergency is pardonable. And fees is not the topic of negligence at all. So coming to some points to remember, that all can make mistakes and most senior and learned can prove negligent because ultimately they feel overconfident. If you're diagnosed brilliantly, don't take the credit of that. It's your duty. But if you miss a palpable diagnosis, that is not pardonable. So these some of the points, especially for senior doctors like me. So if one treats his patients as if he is a very near and dear one, with loving care, so in that comes the communication, and scientifically and adequately, it is unlikely he will prove to be negligent, provided the documents are well kept. So this slide is very important, and I will concentrate on the 3rd point. So A stands for attention to the patient's complaints, his needs. A also stands for additional opinion in time. And appreciate the previous doctor's treatments. Don't criticize. No medical jousting, even if he has done palpable mistake. Aadhaar card. Always insist on a copy of Aadhaar card attached to your indoor paper particularly for gynecologists, because you are treating MTP, POXO, so many other things where minor or major comes into play. You must have the Aadhaar card. B stands for behavior and bills. C stands for communication, consent or denial, compassion. So a doctor cannot be a good doctor without having compassion in his own mind. It has to be imbibed as his own value and virtue. Compassion and empathy. One has to be very cordial in his approach to the patient, as much cooperative as possible, and cooperation with the colleagues also. D stands for documents who are indeed your friends in medical legal crisis. E stands for empathy, expertise, efficiency, and equipment. Sorry. D, F and G stand for good faith. And what is meant by good faith is expressed in section 52 of Indian Penal Code. I don't remember the section number in BNS. I think it is number 35, but not very sure. And I stands for identification and indemnity insurance, which is must for everybody. Identification is done with the Aadhaar card, and indemnity insurance, all of us must be covered. For OPD practice, general practitioners, at least 50 lakhs. For consultants, 1 crore. Super consultants, infertility experts, and all those, at least 2 crores. So that is the current recommendation from my side, to have that much cover. It's not expensive at all. Update and unite and insure. So coming to the communications, please take a note of first 6 P's to begin with. Be very careful about talking to these people when they come as patients. These P's are villains. We included as when they come as patients. So one is press and media people. Politicians, they can really be very helpful, but you have to be very careful what you are speaking to them. Poor people, today they have become very, very possessive and very mindful of their rights with the Aadhaar card linked to their Keshri and yellow ration card. And they demand everything, and they don't want to spend a single pie where they're supposed to get some medicines and all those things. And they're the ones who are creating the maximum problems today in the major hospitals. Police people, when they come as patients, they want that everything must be saved, which is not possible. A case of myeloid leukemia in a hospital like Dinanath, he created a huge problem. When the bone marrow transplant was done, he caught infection, died. But the doctors, 7 doctors were given, booked under 304 that time, just 8 years back. Pharmacists, they feel they're omnipotent in medicine. So be very careful. Pleaders, sorry, Dr. Amitji, Mr. Amitji, but then we have to be very careful about when they come as patients to us. And NRIs. NRIs म्हणजे त्यांना असं वाटतं आपले हात आकाशाला टेकलेले आहेत. So be very careful about them. So some of the guidelines I would like to give is keep a copy of the following 2 judgments on the fingertips of your mobile as well as your laptop. And that is Dr. Jacob Matthews versus State of Punjab, August 2005, and Dr. Martin D'Souza versus Muhammad Ishfaq, 2009. And also keep anti-violence law. It's a 4-page law, 2010 ready. The police people don't know about it because there is no central law. These are not included. I think there was some doctor who is teaching in the police academy in Nashik. I would urge upon her that these 3 should be taught to at least officers getting trained from Nashik, so that why doctors cannot be arrested is clearly explained over there. And every time poor doctor should not be begging for application of the proper section rather than getting section applied for 302 and 304. Get indemnity insurance, keep a copy of registration certificate ready. Shop Act, if you're running a hospital, it's not required for a clinic. Observe the medical ethics fully. Adjust the records well in time. I'm telling openly that if you are required to adjust the records, they have to be adjusted, corrected, correct copy. Once you submit, you cannot change anything. Take the help of medical legal experts in time, not later. Be a life member of IMA, FOXY, or similar body. Do not succumb to any pressures for a wrong cause. Be polite and sweet-tongued. I will come to that again. Call your colleagues in time. if there is or likely to be a crisis. They are not going to criticize you. You call for their help. No cross-pathy and no cross-speciality. BMS people can practice allopathy in Maharashtra. So that is another thing. Don't get unnecessary enmity with them. Homeopathy is not allowed as of now. Please ask any query by email with truthful details. Even our own members don't give all the details to begin with. So don't hide anything from your lawyer. Don't anything from your medical legal colleagues. That's for sure. Unite and cover and have the insurance coverage. Doctors should not go by patient's version alone, but have your own objective assessment. Experiment only if it is required. Expert opinion as and when required, and full record of diagnosis treatment should be maintained for several years. Now, coming to communication, either it can be verbal, but verbal is only 7% of the total communication. Non-verbal is equally important. Your gestures, your movement of face, expression on the face, your shoulders, content of your communication is important. It should be truthful. The process of communication should be gentle, thorough, with knowledge, with your wisdom, experience. And whenever you don't know a particular thing, be very frank that I don't know. I will refer to the expert opinion, or I will call my colleague, or I will refer to the internet textbooks, etc. Because everything you are not supposed to remember by heart and by mind. It should be information to the patient, adequate information. This adjective is very difficult. What is meant by adequate information? It should not be to the extent that, oh, even death can occur in common cold. It should not be that way. It should be that by and large, this patient is likely to take 7 days to heal. Very likely it will disappear in 3 to 4 days. If the patient is not improving, we'll reinvestigate, revisit the case like that, So give as much proper, truthful, scientific information to the patient, but not bombard him with all the information that he runs away from you. Cultural aspects are important. So every culture is different. How much I'm going to say to my educated person or non-educated person coming from rural background, tier 3 city, tier 2 city, what is his socio-economic background, what is his education level. But I can tell you from my experience of 45 years that even the dumbest, so-called dumbest, we feel that he's not educated at all. They understand what is the illness, what is the, not the technical language, but what is his complaint, what his doctor has told him, how to take it, and get it rehearsed from him that he has understood the things. Communication has various levels. It is intrapersonal, patient to me, amongst patients themselves, patient to the relatives, interpersonal, his community. For example, cancer diagnosis needs to be discussed with at least 2 to 3 layers or circles of the patient's community. Organizational, or it can be mass communication on the media, and technological, what we are doing just now. Listening is very important. Important aspect of communication is listening. Majority of the consultants should be listening. Often said than done, I can tell you from my personal experience. I underwent TURP in a very major hospital last Wednesday on 15th of August. This is as recent as that. No doctor talked to me. No doctor asked about the complaints. No doctor asked about the past history. Diabetes nahi na, blood pressure nahi na, doctor baki kai hota ka. I had to tell that I got such and such thing. See, such a thing, behavior, not by the consultants, they are all my friends, but the junior cadre, which is already MS but doing urology now, not touching the patient. The assistant of the main topmost anesthetist not touching the patient and auscultating me is so grave that it's okay that I am a doctor, but what must be happening and what must be felt by, I was there in the hospital for 2.5 days. And this is, I'm telling you, my first-hand experience in 2024, 15th August. So this is the type of teaching going on. There must be good conversation, good communication. Spend 5 minutes and be friend with the patient's agony or good feelings, and they will remember you forever. So listening is very important. Problem with the communication is poor listening. I can take 1 or 2 names here, and I think it is not out of place. All of you, particularly those in Mumbai and Maharashtra, know Dr. I'm so sorry to forget the name, senior most surgeon in Hinduja Hospital, Hindu Colony. And he's a gastroenterological surgeon, very revered. He would give at least 35 minutes to the patients talking. He will extract all the information. Same thing, Dr. Malviya, the #1 rheumatologist in Delhi. He is 85 today and spends at least 1 hour in the first consultation. So poor listening, authoritative attitude. Today are the days I told you patient is the partner in his own care of his health. You cannot be authoritative, you must do that, and don't do that. Nothing like that. You have to explain, counsel, and try to persuade him that he follows that. Daycare procedures, there is total lack of communication. Daycare, if I'm telling you my experience for 2.5 days indoor stay, what must be happening in the daycare centers where one after the other patients are lined for cataract? There has to be counseling the previous evening or in the previous week. Lack of respect and courtesy to the patient. आमचे संचिती सर आहेत ना, डॉक्टर संचिती हॉस्पिटलचे, एक गोष्ट शिका त्यांच्याकडं. प्रत्येक पेशंट आत येताना उभे राहणार आणि प्रत्येक पेशंट बाहेर जाताना उभे राहणार परत. ताई, माई, बाबा, खोटं नाही हा, त्यांच्या रक्तात मुरलेलं आहे. असं आपण शिकलं पाहिजे. Time constraints is no answer. But then even within that time, you can manage your time. The busiest of the person always finds time. Restraining on the decision making by the patient, apan karta kama nahi, that is his own decision. Let him take his own time. This I'm telling all the things when it is a cold case. It is a planned case, not for emergency. Then the communication should be clear, correct, careful. Correct means scientifically correct. That should lead to the trust, so essential in the good doctor-patient relationship. Good communication, see that it's not copyright, it is communication. It's short form for communication. Good communication needs empathy, listening, knowledge, and rapport with the patient. That is your behavior, mannerism. They should be built in. Avoid to be confronted. I remember one of our gynecology teachers, and so many doctors, teachers must be Dr. Anjanilu. Even the youngest lady of 17 and 18, that time there is no POXO, he would say, Amma, kaise ho? So that way was the behavior. Avoid to be confrontational, condescending, and judgmental. Communicate what you document and document what you communicate. Only 7% is verbal, the rest is all non-verbal. Body language, gestures, ambience, voice quality, tone, words you use, misconceptions. Most doctors feel they have great communication skills, but it is other way around. They need to be taught. I mean, they need to be taught, but cannot be percolated into somebody unless he is receptive to the concepts. No communication should be, I mean, you should maintain the professional distance, keep emotions out. Communication skills do not affect the final outcome. Doctor's role is to focus on the diagnosis and treatment. Communication starts. So communication is done not only the doctor, it is from the waiting room. One of my senior colleagues, Dr. Alekar, who was president of IMA Maharashtra State, he wrote an article that how the receptionist should not be. When we were collecting funds from door to door, going to the consultants in Pune to build our IMA building, we visited more than 1,000 doctors. So he wrote a very nice article saying that how the reception should not be and how the receptionist should not behave. So that is the state of affairs. So it starts with the receptionist. It starts with the nurse, Aya, doctors, behavior, body language, smile of recognition, staff, dress, hairstyle, name tags, eye contact, attitude. And the important 7, this is my final slide. 7 key skills of communication are listening versus hearing, empathizing, communicating, financial basics, team. So these need to be communicated. Even financial matters need to be communicated. Teamwork, leadership, and management. So all places you require all these things. You can take a quick picture of this. So these are the things which you ought to have on your desktop. These are the 3 things which I mentioned. These are the links over there. And thank you very much for inviting me over here. I sincerely thank the organizers for allowing me to share my views. And I will stop my slide sharing. Thank you, Revati, once again. And thank you, all of you. You're all eminent speakers, henceforth to follow. If I exceeded my time, please excuse me.
Sir. Thank you. Shall I comment on
Yeah, please.
Dr.
Go.
Revati? Yeah.
Yes,
Thank
ma'am.
you,
Yes,
sir,
ma'am.
for excellent
Yes, sir,
lecture
please.
as always. Yeah. And the tips, wonderful tips, the acronyms you have given. What are the P's, which are important P's? So even if we remember these P's, half of the problem will be solved. As you said correctly, we can prevent the litigation by many things like communication skill, talking with the patient, empathy, etc. The main thing what you have quoted, just treat the patient as if the patient is your relative. If you think like that, the patient is my relative, or if my mother or sister was there, how I should treat the patient. So all these things are very important for preventing the litigations. And of course, who else can talk on medical negligence than Dr. Naurange sir? You have cleared each and every fact, and regarding the judgments, we must keep on our table. So if at all there is some crisis, or even if police person arrives to arrest any doctor, we can show this judgment. And of course, there are many still gray areas we know while fighting the case in the court of law. But still, whatever tips you have given regarding the prevention of medical legal crisis or litigations. So I think communication is the core skill, but documentation, as you have said, correctly said, documentation of the communication and sparing some time for the patient. So that was very important tip given by you. And I remember Dr. Sancheti, because I was in Pune and Dr. Kuthe sir was in Sancheti Hospital. So whenever I visited Sancheti Hospital, I remember sir talking very politely, though he is such an internationally reputed person, very politely and with a touch, human touch. What we lack today in our current new generation, rather. So again, we should not forget that there are many challenges to face. And correctly, if we taught this younger generation, they will also follow the same what you had told in today's lecture. So wonderful tips by you and a practical experience. And I should not forget to mention in the CV of Dr. Jayant Naurange sir, not only his academic excellence, but he has donated blood 67 times, blood donation. One doesn't go for donation for a single time, but he has donated so many times. And again, he's a very fitness freak person. I don't find Naurange sir sitting at one place, always doing one job or other and helping us. So he's a mentor for many of us. Whenever some medical legal issues we face, Dr. Jayant Naurange sir always there. Even if he's not available at that particular moment, he calls us. Madam, तुम्हाला काय काम होतं मी busy होतो. So that's the attitude, that's the greatness of Dr. Jayant Naurange sir. So once again, thank you, sir, for your beautiful,
Thank you, madam.
excellent
Thank you so much for very kind words. And I forgot to mention about Dr. Khartare, who is coming from the same place as Dr. Revati. And Revati happens to be my daughter's very close friend. They were classmates from first standard till 10th standard. So
Yes.
I know her from her young childhood. So Dr. Khartare, all the best to you. And he was the one who communicated to me along with Revati. And such wonderful persons and experts like you as the chairman for this particular seminar.
So the
Thank you so much.
acronyms are so wonderful. I think we can, have some charts made out of it,
Sure,
or a
sure,
small
sure.
booklet which can be, kept in everyone's drawer, because we
That's
have
my
all
that's my
PNDT
favorite slide.
law.
I slow showing each and every lecture. Yeah.
Yeah. So we can have that booklet
Sure.
made, so we can all keep that in the drawer. That would be wonderful, sir. Thank you.
Thank
Thank
you.
you.
So thank you, sir.
Right.
Thank you,
Right.
sir, for your
Over to you,
wonderful.
Sunita.
Thank you, sir.
Right.
Thank you, Jayant Naurange sir, and thank you, Alka Kuthe ma'am, for your expert inputs. Now we'll move ahead to our next session. The lecture is on ethical advertising. The speaker is Dr. Ashok Shukla sir. To chair this session, I would like to invite Dr. Supriya Arwari ma'am, Dr. Kanchan Madar ma'am, and Dr. Ujjwala Dahiphade ma'am. Next slide, please. Dr. Supriya Arwari is a dynamic personality. She is consultant obstetrician, gynecologist, and infertility specialist practicing at Thane. She is trained for she has done MD at KEM Hospital, practicing at Supreme Hospital since past 20 years. National Coordinator, Foxy Adolescent Health Committee, Chairperson of Association of Maharashtra Obstetric and Gynecological Societies.
Sunita madam.
Secretary of Thane Obstetric and Gynecology. Yes, ma'am.
Madam is
Secretary of Thane
traveling.
OBGY Society.
Yeah, yeah.
Oh.
I guess she's not able to join. She's not in the network area.
Okay, okay. Our next chairperson is Dr. Kanchan Madar. She is President of Cultural Wing of IMA Chipurun, Chairman of IMA Women Doctor Wing Chipurun. She is President Appreciation Award 2023 winner, State IMA Navdurga Award 2023. She is presently selected as co-chairman of IMA MSWDW. Welcome, ma'am. We would
I
like
think
to invite
Monica.
our third chairperson, Dr. Ujjwala Daifare, ma'am. Madam is famous plastic surgeon from our city, Aurangabad. She is associate professor at plastic surgery at Department of Government Medical College, Chhatrapati Sambhajinagar. Postgraduate diploma in hospital administration management. She is MMC accredited speaker and observer. She has tremendous work on Smile Train project, a very academically well-known person. Welcome, ma'am.
Supriya ma'am has also joined. Sunita, Supriya ma'am has also joined.
And Suyoga, I am here now.
Okay.
Yeah, yeah. Supriya ma'am?
Will request our chairpersons.
Yeah.
Welcome, Supriya ma'am. Will request our chairpersons to kindly introduce the speaker, Dr. Ashok Shukla, sir.
Ujjwala madam?
Research नहीं है.
मैं share screen करूं? Can you hear me?
No, no, we'll introduce you, sir, first. Sunita, can you continue
अरे
with the-
slide मध्ये दिसतंय मॅडम मला ओळखतं लोक.
नाही. No, I'll move ahead with the introduction. It's an honor to have you, sir, consultant gynecologist and medical legal expert. He is honorary secretary of Obstetric Gynec Society, Mirabai, organizing committee member AICOG 2025, and immediate past president AMC. Past post held IMA Maharashtra State Medical Legal Cell and past IMA Mirabai and the president and trustee Bhander Medical Association. It's an honor to have you, sir, and let's move ahead with your talk. Thank you.
Yeah, I'll just share my screen.
Yes, sir, please.
Share your screen, sir.
हो रहा है share? नहीं, you have to first option. I think so some. I stop किया मैडम?
The screen नाही दिसत आहे. Have you shared it?
I'm just hold on.
Yes, we can see the
You're
desktop.
doing it correct way. You just click on a share screen, share. But it's no escape mark there.
The PPT open केलंय का? So the desktop वरचं तुम्हाला
PPT
direct.
open नाही झाली.
हो, PPT open आहे. I think so. Just I'll again.
तर तुम्ही share वर क्लिक करा खाली.
His
पण Zoom
screen
आता
is
अपडेट
already
झाले
shared.
त्यामुळे बरेच नवीन ऑप्शन आले.
माझं स्क्रीन काय दिसतंय का?
नाही दिसत आहे. स्क्रीन नाही दिसत आहे.
नाही, desktop दिसतोय ना.
माझं डेस्कटॉप दिसतंय?
Yes, sir.
आता?
ICC चे yes, sir. Desktop is. नाही नाही, आता move नाही होत आहे.
दिसतंय?
No, no.
नाही दिसत आहे.
Just hold on. I'll again try.
Hello, Revati. Am I audible?
Yes, yes.
Ah,
now
you are Supriya
waiting
audible.
for you. We were waiting for you.
Yeah, I'm taking the chance to say a few words before I again go out of network area.
We miss your sharing.
You picked up the very perfect speakers, and Ashok, for one, is a very dear friend, a great medical legal expert, and an excellent human being. He's a wonderful leader. I have worked with him when he was AMC president. It's really honor for having him here as a speaker. And let the other chairpersons introduce him. But I wanted to give this introduction about him as a human being.
स्क्रीन शेअर होत आहे आता दिसतंय का माझं स्लाइड्स
नाही सर
नाही
screen
सर.
गिव्ह मी जस्ट 10 seconds जस्ट 10 seconds I have
ओके. तुम्ही दिसताय ते खूप आहे आम्हाला.
अरे नहीं बेसिकली आई एम इन विरार या तो
है.
देखिए स्क्रीन शेयर नहीं हो रहा है मेरे को आवाज आ रहा है बट मेरे को स्क्रीन नहीं दिख रहा है क्यों नहीं दिख रहा है मालूम नहीं हाँ ये तो है उनको मेरी आवाज सुनाई दे रही है बट मैं जूम खोल रहा हूँ तो मेरे को जूम भी नहीं दिख रहा है ये देखो हाँ ये है हाँ अभी शेयर स्क्रीन में ना ये दिख रहा है वो नहीं दिख रहा है विंडोज में मेरा वो पीपीटी दिखना चाहिए जस्ट 10 seconds ही इज जस्ट डूइंग
Yes, yes.
दिख रहा है नहीं हो रहा है Riti, I have forwarded you my PPT also.
Okay, sir, we can play
So that
that. Just a
yeah,
second.
so if we'll just you can also download. So the next maybe 1 minute it starts fine. Otherwise, I'll
Yes, sir, we'll keep that ready. Yeah.
नीचे शेयर है ना शेयर कर रहे हैं तो हाँ ये खुला
Hi
है बड़ी
Revati, hi Ashok. Can you hear me now?
Yes, yes, Supriya, I can hear you.
I don't know how much of the introduction I gave you all people heard. So
नहीं भी all
again, I
heard.
would
सुप्रिया
like
बोले और नहीं सुने ऐसा हो नहीं सकता.
I'm traveling, so there is very little range and it's
Riti,
coming
you
and
have
going.
received the PPT. I have sent you on WhatsApp.
Yes, sir, I have already forwarded to him.
Okay, so if he can run, so
display it.
we can
Yes,
just
yes.
yeah. So I think so. I'll
Pranjal,
stop share screening. Let him display.
Yes, yes. Pranjal, you've received it, right?
Yeah.
Pranjal?
Yeah, I have received it, ma'am.
Yeah, so you can play. I'll just tell you next slide, so you can directly do from there.
Yeah, just give me 2 minutes.
Yeah, till then I'll start my talk so that we can
fine.
save time. So at the onset, I would like to thank the organizer, Dr. Revati, for giving me this opportunity. Amogs, Supriya for the fantastic the introduction. And whenever you give a talk after Dr. Naurange sir, it feels like after Sachin Tendulkar you are coming for a batting. So you can imagine the amount of nervousness the next batsman have, because everybody wants him to do more and more better, which is not possible because Tendulkar is Tendulkar. You can't have anybody else who can match also to Tendulkar. So hats off, sir. As always, perfect and to the point with all your examples. Yeah. So today, a very interesting topic I have been given about the ethical advertisement. Now, everybody knows. Yeah, next slide. Everybody knows that we have a very noble profession. Can you shift this next slide? Very noble profession, and everybody expects from you that you should do charity, good work, and not advertise. Now if I am very good, yeah, next slide. If I am very good, how the patient outside the next building know that I am very good? For that there should be some advertisement, but then there is always a fight between the ethics, whether it is ethical. So one side I am in a profession which is noble, the other side I also am under Consumer Protection Act, where that person who comes to take treatment is a consumer. Next slide, next slide. Pranjal.
त्याचा पण network issue आहे, I guess.
ठीक आहे, yeah, you can shift. Next slide. Yeah, next. So whenever I say next, you change the slide. Next. Yeah, no problem. I'll. So in the older time, the best thing was the doctor-patient relationship. So whenever a patient comes to you, there is a inbuilt doctor-patient relationship which sets in, and a doctor-patient contract comes in existence. Whether it's an implied consent, written consent, but there is a contract between. In the older days, next slide. In the older days, next. So in the older days, if anything goes wrong or if there is something, then this used to work. कि जाने दो. But today things have changed. टुडे डॉक्टर्स ऐसा टच किया तो अभी सर ने बोला पॉक्सो, फीमेल पेशेंट रहेगी तो उसका तो और दूसरा हो जाएगा, तो मालूम पड़ा कि लेने के देने पड़ गए. सो थिंग्स हैव चेंज, द परसेप्शन हैज चेंज, द थॉट हैव चेंज. The patient has now started approaching doctor like a consumer. He sees your detail, he sees your board. In fact, he asks you that वो जो क्वालिफिकेशन लिखा है, इतना सारा लिखा है, सब आपका है, आप इतना टाइम पढ़े, कितना पढ़ रहे थे? There are patients, and it's good ki now MMC is coming with a QR code, and there will be a QR code outside your clinic where patient can just scan. And the moment the patient scan, he knows all about you as per the MMC record. Next. But advertisement, there are a lot of moral principle, the ethical principle that prevails. According to that, you have to have those principles. Next slide. Next slide. Now, the purpose of advertising, what basically from a doctor angle, is to get more patients, to generate more brand awareness of his hospital. Good advertisement. Now, today we have multiple ways by which we can advertise. So there are companies who are third parties who do your advertisement, branding. Now there are departments. The corporate hospitals have a department, marketing department. So the name itself says marketing department. So that means to market. Next slide. But then what our ethics is, no doctor can make high claims about any procedure. Indian Medical Association 2016 said, do not use these words, no cure, no payment, guarantee cure. These are our objectionable advertisements. These all words sometimes we write in our pamphlet, in our file, in our board somewhere, which can become very dangerous if a patient files suits against you, complain against you. Next slide. Now there are different acts. Now in Drug and Remedies Act, the advertisement by doctors are prohibited in any media. But in Drugs and Remedies Act, if you'll see, the punishment is very small. It's a very old act. Lot of amendments supposed to happen. You still see in television, lot of time people take benefit of Drugs and Remedies Act, Drugs and Magic Act, and they say ki, see, they are very smart, surrogate advertisement. They will not say, see, if you'll see, lot of channels will have those advertisements of lot of doctors. मेरा पैर बहुत दर्द हो रहा था, फिर मैंने ये जेल लगाया, जेल लगाने के बाद मेरा दर्द गायब हो गया, आता मी धावायला लागलो, आता मी वाकून. When you go to the court, the judge asks, who had told you to buy this? The opposite party will say, see, we never marketed this. There was a person who have used it. He felt happy. You followed him. Now you see, you go on Facebook, वो बाल वाला है, पहले एक चालू हुआ, फिर उसके बाद बहुत सारे आ गए. ओरिजिनल कौन है? But everybody claims that he is original, and there are one or two who are using celebrities also, and who are indirectly. So these are surrogate marketing which people use, and there are acts where the punishment is very small. So there are some hospitals also trying to use it, the benefit. The code of ethics says you cannot use the guarantee treatment word. Next slide. So a lot of time we feel whether these are all verbal, really action takes place. Yes, but there has to be a complaint. A lot of time members say, doctor, there is no action. See, they are doing so much advertisement. But then there has to be a complainant. See, it's like if person is going in train and TC doesn't comes and he's without ticket, uska kismat hai. But there has to be a complaint, somebody has to catch. But the problem is everybody feels ki I don't want to complain, but the association should take action. There will be somebody who should go and tell they are doing a lot of unethical. There has to be complaints. So in the past, if there are complaints, whether there are action, yes. MMC had suspended licenses of that doctor couple for 3 months for putting the advertisement following complaints that they had promised guaranteed pregnancy on their IVF clinical website and even offered refund if the treatment failed, which was violating the ethics 2002. Next slide. So they were suspended. These are fair cases, real cases. Next slide. Now, Tamil Nadu Council in 2016, the council asked doctors to withdraw their names from online registries. See, there are a lot of people who are paying for online registries. See, whenever there are complaints, they are going to face action because they have to justify. Because whenever somebody goes on online, he searches, your name comes, you're paying. You're paying, that's the reason come. Do you feel you are really that much famous and that's the reason Google or the other people are getting your name at the first? No, everybody knows. And now to be on the safer side, if whenever you go on Amazon or anywhere, they will show who are really famous, but there are taglines sponsored. So those are sponsored names also. Hospitals are using also that benefits and they are trying to use. And in this, there was a complaint in 2016. They were asked to withdraw their online registries, remove advertisement, names, photographs, specialty contact details everywhere. There is still a big fight going on. The MMC, I'll tell in the future slides, because a lot of time people are using these advertisement platforms to post their data and their details in the marketing fashion. Next slide. So Maharashtra Medical Council had given show cause notice to 40 doctors for putting up advertisements in print, TV and social media. And after hearing, some doctors were issued letters also. Now, Medical Council has taken show moto actions also. Many Delhi hospitals had put advertisements. But the fight, what happens is, a lot of time, the corporate hospitals use the doctor's name on the photographs and say the first liver transplant center, the highest success rate IVF center, the lowest complication rate ICU centers, and they put doctors who are attached in their hospitals on those dim lights, and a lot of time they'll end up with complaints from the council. Next slide. So what is allowed? I'll not go in details, but these are allowed because doctors feel then there is no level playing field. How I can put my ad? So on starting your practice, change type of practice, change of address, temporary absence, you can put in the local media, newspaper. In fact, I had received a complaint from a surgeon about another surgeon. And what the other surgeon used to do was surrogate marketing. So he had paid the cable TV channel for the whole year. And what they used to do is, माझ्याकडे 2 सिस्टरांची गरज आहे, कृपया कॉन्टॅक्ट करा. डॉक्टर सो एंड सो, renowned surgeon, hospital name, address, call number. So now renowned surgeon नाव टाकण्याची काय गरज आहे, sister? So that means people will read that ad. It's like, they will see, and the indirect marketing will happen. So these are things which people are doing. How it can be stopped, we will discuss. So here again, these are different ways which are allowed. I'll not go in much detail because these are as per the ethics, and the next slide would be on NMC. Next slide. So the NMC advertisement, the advertising 6.1, it says soliciting of patients directly or indirectly. These are very important words, because directly or indirectly by a physician, by a group of physicians, or by institution or organization is unethical. A physician shall not make use of him, her as subject in any form or manner of advertising or publicity through any mode. See my words, any mode that becomes print, digital, creating a image, having your mirror with a photo, or some light designer, or धुआं जिसके अंदर your hospital name come, or the ice cream जिसके ऊपर वो coffee center के ऊपर. These are all different ways, because see, these are different methods which people were trying to use to bypass the system. To him or his professional position, skill, qualification, achievements, attainment, specialties. So we can write 100 papers in this, but not in the public media, because here all are doctors. So you cannot do in this common platform because they feel you are doing marketing. A physician shall not give any other person whether for compensation, otherwise, any approval, recommendation, endorsement, certificate. Now, why this line is, people used to feel कि अरे वो मेरा फोटो लगा दिया हॉस्पिटल वाले ने, मैंने थोड़ी बोला था, मैं तो उनके डिपार्टमेंट में काम करता हूँ, और फोटो किसने भेजा व्हाट्सएप पे उनको, ईमेल किसने किया, नहीं वो मैंने ड्यूटी ज्वाइन किया था तो. सो इसके लिए दे विल नॉट गिव परमिशन टू एनी पर्सन फॉर यूजिंग देयर डिटेल ऑल्सो. नेक्स्ट स्लाइड. प्रिंटिंग ऑफ युअर सेल्फ फोटोग्राफ, फाईलवर आपला फोटो मस्त, बाहेर हॉस्पिटलच्या बाहेर बॅनरवर फोटो, any such material publicity on the letterhead, signboard are considered self-advertisement and unethical conduct on the part of the physician. However, printing of sketches, diagram, picture of human system shall not be treated as unethical because those are you are using to explain to the patient. Next slide. So these whatever words I'm saying, now what are the penalties? So this is something which is very important slide, because the older rules regulations people are aware, they know what would be the warning, but here we have now CCPA penalty for any misleading advertisement. Under section 21(4) of the act, any person who publish false and misleading advertisement may be punished with imprisonment or penalty which may extend up to 10 lakh rupees. Next slide. Now what is CCPA? Now the CCPA, this is Central Consumer Protection. This has come under the CPA, the new act. Next slide. Now this were some, the CCPA passes order. The CCPA has suo moto powers also of discontinuation of censored ads in India, and they had fined them 10 lakh rupees. Next slide. So establishment of CCPA with required statutory power is another additional agency which is keeping a watch on you. They also have a power of taking suo moto action against you for unfair trade practice, amplifying the ground of complaints, penalties, deceptive advertisements, product safety and liability. So we have to be very much aware, because this came, the CPA came just COVID ke time pe. People are getting aware, the consumer are getting aware. The moment they get more and more aware, you will see more and more court cases under this. Next slide. Online advertisement. Now, whenever a patient goes on search, you also today want to konti picture चांगली आहे, तर हे आहे. So you go on online, you remove that, you put that movie name, and then whichever is closest theater, everybody is there. So even my relative wanted to get a knee replacement done. I told him ये अहमदाबाद में अच्छा सेंटर है. हाँ, मैंने इसका पूरा सर्व कर लिया, इसका रेटिंग अच्छा है, इसका डिटेल्स अच्छा है, इसका ये पैकेज है. So indirectly it is a good thing if you allow the doctors, but you have to have some regulation. You have to have some regulation. So whether searching online, there are bound to mention about healthcare professionals, doctors in your area, specialty which are available. In the competitive market where you have so many people who are specialists and super specialists, you have to be seen. Then only members or the patients might come to you saying that he is more qualified for my problem, because the problem which I am facing, he is written that he has special interest or he has a special qualification in that, for which I will go there and visit him becomes. But the relationship building should not be considered unethical. This is the doctor's feeling when they are arguing when the hospitals market. Next slide. Now the Google rating. So there is a court case going on out of India, and it's fantastic, because whenever the doctor had approached the court saying that, who is this patient to rate me that I am a good gynecologist? He's a layman. How can he comment on my treatment method? How can he give me 3-star, 4-star? On what basis he's giving me? He's not authorized. If he tomorrow says, I'm not happy with Dr. Shukla, but how can you determine my treatment pattern, my work? So let's see how the court approaches there, because this judgment will be very good, because they have said why Google has given a platform to them. And if a patient alleges that Dr. Ashok Shukla treatment was not good, whether Dr. Ashok Shukla can revert back on online, he can't, because then it will be breach of patient confidentiality. He has to reveal the patient's name. He has to reveal the patient's details. That patient is 2-time IVF failure. I had done 3rd time. I had told her to take this medicine. She has not taken. It will be breach of confidentiality. How can I do this? Next slide. This is a very famous You would have seen in the news channel Supreme Court on regulation of misleading advertisement and accountability of public figures, because a lot of public figures are there who are coming online and doing themselves online marketing, as they themselves a big brand. Next slide. Now these are two things which I'm going to discuss in next 5 to 6 slides, because very good remarks have come from the court. Now here the Supreme Court has said that misleading advertisement, the inefficiency of the regulatory mechanism, and the liability of endorser and influencer with respect to misleading advertisement. You will see there are a lot of YouTube channels and other where there are a lot of influencers who have come in market. Now, who have qualified them as an influencer? Are they really trained in them? There is no law at present, but Indian government is trying to take them also in the ambit, because they come online, they have a big fan following, they say something. In between there was an influencer who said in Delhi metro कि मैं इधर आने वाला हूँ, and there was so much crowd कि ultimately police had filed an FIR against him. That how can you put here कि I'm going to come here without taking police NOC, because there were 10,000, 20,000 people came. So they have a big fan following, which this corporate and other people are trying to use it, because they are influencers. If they say कि I had gone to this doctor is good, it will be a big brand marketing. So Supreme Court emphasized to need have stringent application of guidelines issued by the Consumer Protection, that is CCPA, that is guidelines for misleading advertisement and endorsement. So Supreme Court has told 2022 guidelines should be implemented very strictly. Next slide. While observing the liability of the advertising agencies also, the government also, the Supreme Court said, when the person is giving an ad, the advertising agency also should be under liability, under this ambit, advertiser. The endorsement made by public figures, influencers, celebrities, even if it is a surrogate ad, they themselves are big celebrity. They themselves can use their common presence of mind कि McDowell का पानी का बॉटल क्यों बिक रहा है. देर आर कि भाई इलायची क्यों बेच रहा है एक कंपनी, बट वो इलायची के लिए ब्रांडिंग है क्या. So these are surrogate ads which sometimes hospitals are also using. Next slide. So while observing the role and responsibility, these are again the part of the CCPA, the Supreme Court which has commented. Next slide. Now, this is very important line which is going to change future. Supreme Court said that the obligation on part of broadcaster and print media, broadcaster, your news channel, media channel, online OTT platform broadcaster, and print media has to file a self-declaration form prior airing such advertisement, stating that the said advertisement is a complete compliance with provisions contained in but not limited to Cable Television Network 1995, these are all including the Code of Self-Ethics, Guidelines of Prevention of Misleading Advertisement, Endorsement of Misleading Advertisement 2022, means they help to give a self-declaration. I have gone through, and they are not infringing or creating any contradiction which has been given in this. Next slide. The Supreme Court, while recognizing the underlying liability and accountability, best out that stressed upon that their advertising should be their ethical advertising practice, which shall be governed by the principles of consumer welfare. See, their interest was, if you are advertising, it should be ethical, means it should be for the consumer benefit, not for your benefit. It should be for consumer benefit. In the era of digitalization, now smartphone, internet has become an extremely crucial and monitor of circulation of advertisement endorsements. If you'll see print and digital media goes like fire. If you that hashtag handle in Twitter, Facebook, everywhere. Next slide. Now, the Supreme Court, this is again very important, 3-4 slides last. The biggest fight was the doctors used to feel that we are doctor, we are bound by the ethics. Our council is not giving us liberty and we are not giving level playing field. Then the NMC tried to involve the hospitals, but the hospitals, how can you involve? What action you can take? We are not registered with you. For example, if I am a non-medico owner of a corporate hospital, I'll say I'm not registered with you. Why should I come and attend your call? What action you can take? You are not my registering body. So there was a court case on 4th December 2023. The Supreme Court response to a writ petition issued a notice on October 10 to address concern regarding regulation of advertisements in corporate hospitals. The petitioner argued that unlike private medical practitioners who are prohibited from advertising, there is no such clear-cut restriction in place of corporate hospital. Justice Sanjay Kishan Kaul and Honorable Justice Sudarshan Dhulia for forming the bench directed the notice to NMC and the Union Public and the Ethics and Registration, the EMR board. The PIL was filed by Narayan Anirudh Malpani seeking comprehensive guidelines for corporate hospitals so that we have a level playing field. Next slide. Now here there are very important things. The petitioner highlighted the issue of unchecked advertisement by corporate hospitals, venture capital funded healthcare. So now you have a lot of funding to all the corporate setups. They have startup companies, healthcare, you have pharmacy labs, you have centers, IVF centers, many things. Now these, according to the petitioner, infringing upon the patient's right to make informed healthcare choices because they feel these ads are manipulating and misleading them and violating the Article 14, 19, and 21 of the Indian Constitution. The petitioner argued unethical advertisement by corporate contradicts the Indian Medical Council. It also prohibits soliciting of work by medical practitioner. But they say we don't come under NMC. We come under Clinical Assessment Act. So how NMC can take action against us? So those rules will not be applicable on us. Next slide. The petitioner argued that unfair advantages to the corporate hospital because they are having hoarding. You will see bus stop also. You will see pamphlets, scams. But we doctors are not getting excessive or misleading healthcare advertisements can lead to uninformed patient decision, eroding the trust between doctor and patient because ultimately when the patient comes to the center, ultimately the doctor is the person who is going to give his services. Next slide. Now here this is the recent one on the same case following. Now there is an internal panel formed by the NMC in planning to endorse only ethical advertisements. The NMC 7-member panel was formed following the Supreme Court directive, which I was telling on that PIL. And the PIL contended that there is an alarming situation created by unfettered advertisement by corporate hospitals and the newly emerged venture capital funded healthcare setups. The next slide. According to the document latest available, they said that the advertisements applicable to doctors should extend to hospitals also. It should include corporate hospitals. See, if you will see the rules, regulations, the corporation rules, the municipal corporation, there is no clear-cut definition of clinic, daycare center. Somebody has so and so nursing home, somebody has so and so hospital, somebody has so and so multi-specialty hospital. So there are different wordings used. Whether those wordings have some legal definitions or they are there, these are very gray zones which are people are taking benefits. Section 10(1) of Indian Medical Council clearly lays down policies and code to ensure observance of profession ethics in medical profession and not by medical professions, which clearly means that NMC can intervene in the hospital also. And this is minuted, and let's see how the Supreme Court judgment goes next. Next slide. Last two slides. Now these were some proposed norms which are already there, that the nursing homes, private hospital, rehabilitation centers, medical institutes. These were the definitions which are said. There are different wordings which people are using. Next slide. Now, this is important that you have to balance between promotion and ethical conduct. Healthcare stakeholders can contribute to a more accessible, informed, and trustworthy healthcare ecosystem in the country if they all have some self-regulatory guidelines of doing this marketing where doctors and hospitals have a level playing field. Next slide, and this is the last slide. Now, when this so much stress, competition, the first slide says that you have to balance between ethical, unethical, hospital, the dual role, because you are the director of the hospital, you are the consultant of the small nursing home. You have to understand the whole thing runs on faith. The patient faith on the doctor is slowly getting deteriorated, which is not good. There is increased stress on the doctor. We are doing so much medical legal programs. You have seen Dr. Navarange sir saying, Dr. Walke sir is there waiting. Then Advocate Amit Karkhan is, you would be hearing so much. I always tell at least 10 minutes meditation in the morning to recharge yourself. Give time to yourself. Do some amount of exercise. Spend some time with your family, because in medical legal cases, when you are depressed, your friends will be available with you on phone, but your family will be sitting with you and sharing your stress in your personal life and practice. buy a good amount professional indemnity insurance, so that if there is any issue, you just forward those details and have a good relaxing time. Let them manage your matter, and you don't get those stress interfere in your practice. Because I have seen members telling, डॉक्टर आता काय उपयोग नाही, मी तर आता स्टॉक मार्केटमध्ये चांगलं इन्कम आहे, मी आता विड्रॉ करतो प्रॅक्टिसमधून, आता हॉस्पिटल भाडेवर देतो, रिडेव्हलपमेंटमध्ये ह्याला बँकेला रेंटवर देतो. शुड नॉट हॅपन, because ultimately what we do, we are the only people who really care for life. Society is there, but if there are no doctors, the society will be of no use, because all would be sick. Next slide. Thank you. So hope I have expedited the speed.
Yes, sir. Thank you, sir. Sunita?
Yes. May I ask our chairpersons to give expert remarks? Supriya ma'am, Kanchan ma'am, Ujwala ma'am.
Supriya madam?
Kanchan ma'am is not there. You can ask Monica if she's there.
Thank you, Dr. Revki and Suyoga Madam, for having me on this platform today with all of you on an excellent event on medical legal issues. Dr. Ashok sir, you have covered the ethics of advertisement so beautifully that it will always stay engraved in our minds. It was a light-hearted lecture, but very, very important take-home messages. I think all of us should take into account the first and the foremost is service first, and keeping yourself medically safe in all aspects is very, very important. Thank you so much, sir. Supriya ma'am has come, ma'am.
Thank you, Ashok.
Thank you.
Yeah. Thank you so much, Ashok. Wonderful talk, I must say, on such a difficult subject, because sometimes we really don't know whether we should or not advertise and how to deal with things. Thank you once again. It's always a pleasure to listen to you.
So now we move ahead with the second
Thank you,
session.
Supriya ma'am. Monica ma'am,
Yeah,
for your words.
Sunita. Yeah. Varke sir had some network issues, so we had started with the third session. Now we go back to session 2. Over to you, Supriya.
Yes.
Yeah.
Session 2 speaker is Dr. Dilip Varke sir. And to chair this session, we would like to invite Dr. Girish Kumthekar sir, Dr. Varsha Lahade ma'am, and Dr. Swapnanjali Awad. Next slide.
Can we have the PPT, Pranjit?
Just a minute, ma'am.
I guess as network issue खूपच आहे because of rain or something. I don't know.
भयंकर पाऊस चालू आहे, ma'am. Is it visible now, ma'am?
Yes.
Yes. Dr. Girish Kumthekar sir is consultant obstetrician, gynecologist, and medical legal expert. He is
Immediately दोनों हाथ
practicing since last 35 years. Infertility practice since last 15 years. He owns a private hospital in the city of Solapur, partner in Pioneer and State of Art IVF Center, Navjeevan Fertility and IVF Center. Welcome, sir.
Thank you. Enough of introduction. Thank you.
Yes. Our second chairperson, we would like to invite Dr. Varsha Lahade, ma'am. CV, please. Varsha Lahade, ma'am, is district civil surgeon at Nandurbar, Maharashtra. She's working in public health sector since last 31 years. She's worked in tribal zone, strengthening family planning services, master trainer for PPIC, IUCD, RCH, CSSM. She has highest number of gynec major surgeries in government hospital. She is past president of Nashik OBGYN Society, past zonal coordinator of Amogs. Welcome, Varsha ma'am. Our next chairperson is Dr. Swapnanjali Awad. CV, please. Dr. Swapnanjali is consultant obstetrician and gynecologist practicing at Nashik Road. She is co-chairman of IMA MS Women Doctor Wing. CV, please. Next slide, please. About Dr. Swapnanjali, she is member of Socio-Cultural Committee, IMA, immediate past president of IMA Nashik Road, Maharashtra, convener of Women Doctors Wing, IMA Maharashtra, director of Awad Maternity Home, Nashik. She is director of Sparsh Garbhini Sanskar Center, Nashik. Welcome, Dr. Swapnanjali. I'll request our chairpersons to kindly introduce our speaker. Next slide, please.
I think Swapnali and Varsha are not there. I think I am the only person.
Yes, sir. You please introduce.
Yeah. Well, Dilip,
Yes.
Dilip, welcome. And well, how can I introduce Dilip? We have been working together for more than 2 decades. And we have been together in so many conferences. We exchange our views, we exchange our slides also. We give ideas to each other about how to present, but Dilip is far ahead. And in spite of not being an actual legal person, he has not done LLB, but he's much more than a legal person so far as medical fraternities is concerned. I'm not going to introduce in a traditional manner such and such Dilip and his birth, date of birth and date of and all these things. But the way he explains the medical legal problems, the way he helps, some of them have come out of his own experience. Some we have shared, but he has always given a very good advice to medical fraternity. He has been helpful to colleagues, brothers and sisters in our profession in Pune, umpteen number of times. And though he is not a legally learned person, well, he is very much ground to earth and his feet are always on the ground and he will always give advice. And I like his always a first statement, abundant precaution. And that's where he bases his deliberations always. Let us not waste our time, but Dilip, welcome again. And we are really eager to hear you about the BNS. Thank you. Thank you for giving me the opportunity to introduce my very nice friend, Dilip.
Thank you, Girish. It would have sufficed if you had just mentioned Dilip is a friend of mine. That would have been enough as an introduction. I cherish your friendship more than anything else that you have spoken about me in the introduction. So, will you make me the co-host so that I can share my slides here? Can you hear me, all of you?
Yes, sir. You
Yeah,
can
I'm
go
going to have a
ahead.
little. Yeah, I have a little network issue. I am logged in through the mobile hotspot. So the moment I get a phone call, I'll have to I'll get cut off for a moment. I'll not take the phone and I'll come back again. So that's what I'm warning everybody. For a moment, the network might just go for a second or two. As soon as I ignore the call, I'll come back. So that's what it is. Please make me the co-host so that I can share my slides.
Vishal, Pranjal. So you try sharing it because I guess you can.
So
Can you just
this slide has to go, no? Unless this slide goes, how can?
This slide has to be.
Yeah, unless this goes.
Just a second.
Do they have a network issue there?
Yeah, they do also have a network problem. Just a second. Give me 1 minute.
Session 2, wait, this is.
No, he has to stop. Shall I try?
Yeah.
Yeah, it's gone now. So I'll try to start sharing. Can you see my slides?
Yes, not yet, sir. Started sharing. Yes.
It is seen, no?
Yes.
Yeah.
Yes, sir.
I'll
Yes.
just, start with the. Just a moment. I'll start sharing from the beginning. Yeah. Can you see this?
Yes,
Can
sir.
you see my slides?
Yes, sir.
Hello. Okay.
Yes, sir. Yes, sir.
So basically, topic for me today is criminal. Fine. So can you hear me now? Hello.
Yes, sir. We can. Yes, sir. We can hear you.
Yes, sir.
Can you hear me?
Yes, sir. Very clear.
Yes.
Okay. Fine. So at outset, let me thank the Amogs and the IMA, especially my like Kiran, who's logged out. I know he's listened to me so many times in the past that he gets irritated when I'm speaking. So Kiran is not there, Bipin is not there, Ammay is not there. It only shows that they are good friends, and they will say, "Arey Dilip, bas ho gaya, bahut baar sun liya hai tujhe." Ajay also is logged out. But then I'm very happy and thankful to the organizing team, Revati, Suyoga, Santosh, and I'm truly honored. And I don't think I deserve to be a faculty alongside people like Naurange sir, Amit Karkhanis, and Ashok. And Ashok was saying that speaking after Naurange sir is like speaking after Sachin Tendulkar, and speaking after Ashok Shukla is like speaking after Rohit Sharma, because he came and he was owning the whole webinar. The kind of sixers that he hit in the topic that he was given was something that I learned a lot from today. And I'm relieved today because my only chairperson today is Dr. Girish Kumtekar. He's going to help me more than give any comments on my talk. I usually start with this disclaimer to say that I'm not a lawyer or author of any medical legal books. My credibility as the chairman only is as the chairman of the Ethics and Medical Legal Committee of FOXI. I was involved in advocacy and judicial activism through FOXI. I co-authored the Uniform FOXI Consent, and I organized many medical legal events with legal luminaries as faculty. And my friendship with these legal luminaries make me look like a medical legal experts, which actually I am not. As Girish already told you, I am not a legal person. But what I do is, the secret of my talks is I listen to them. People like Girish, people like Amit, people like Navrenge sir. I listen to people like Shukla. I listen to them and I nag them till I decode all the legal jargons that they use in their talks. And what I do is I explain that in a simple language in my presentation, and to that, as Girish told, I add my tadka of abundant caution. And that's how I make my presentation. The agenda for today is to understand the BNS and the Bharatiya Nyaya Sanhita and criminal medical negligence in simple language. A disclaimer again is that BNS is new, so it has to stand the test of litigations and case laws in our court. And that's the reason why my interpretation about BNS may at times be incorrect. So I stand to be corrected when it comes to some comments or disagreements to the BNS. So what we are going to do today, we will all agree to argue, but eventually we will want to get some carry-home messages in our practice, because that is what everybody who's attending this webinar is looking for. So let's start with some basics. And the first basic question is, when is it that a doctor is criminally implicated? We are usually implicated in a civil case or a consumer case, but when are we criminally implicated? So we get criminally implicated if we contravene acts such as MTP, PCPNDT, ART, Drugs and Cosmetic Act, or Biomedical Waste Act. So there we can have criminal implication. Other criminal implications, like anything other than medical negligence, if you like humlo chori kar diya, or you created a murder, then the punishment, naturally, just because you're a doctor doesn't mean you're not going to be criminally implicated. But there is where we can be implicated, or in cases of medical negligence, or if we do a cross-pathy practice, because cross-pathy practice is considered to be negligence per se. The second basic question is, how is criminal negligence different from civil negligence? So civil negligence is fought in a civil court or a consumer court, and that is where the patient or the relative is asking for compensation. They are not asking for arrest. Basically, they want to be compensated for whatever wrong we did to the patient. And the negligence here is of a lesser degree, like should have monitored the drip, or a conservative treatment was warranted, or consent was not taken. These all things are come under civil negligence. And all the medical college committees and the civil surgeons should be very careful when they are giving opinions about this civil negligence, because all this that I've mentioned can be given there. So you can mention even smallest of negligence if you feel that in this case such a negligence has occurred. So if the civil court or a consumer court comes to you and asks for what is the negligence in that case, you can write all that. But when it comes to criminal negligence, this is fought in the criminal code. it is when the relatives want the doctor to be arrested, which means you have done such a gross negligence, like a wrong patient was operated upon, wrong side was operated, or a mop was left inside the abdomen, or you gave a drug despite knowing the allergy to that drug. Here is where you can be implicated criminally. And if this case the police gives this case to you, the papers to you, to the medical college committee or the civil surgeon for opinion, then if you find that there is no gross negligence, simply write no prima facie evidence of gross negligence. That is when your doctors will be saved from being arrested. So the medical college committee or the civil surgeons will have to be very careful about giving opinions to something that has been asked by a consumer court versus something that has been asked by a police for a criminal case. The third basic question is, what are the effects of criminal medical negligence? So there can be two effects. One is death of the patient due to gross medical negligence, or injury to the patient due to gross medical negligence. And this injury can be simple or this injury can be grievous. Now, what are the punishments for these is what we have to learn from the BNS. If there is death due to gross medical negligence, that is defined in the legal language as rash and negligent act not amounting to culpable homicide, यानी आपने कुछ treatment दी, उससे death हो गई and it is not appearing to be like a murder. In that case, the sections under which we are tried for cases occurring before 1st of July 2024 were according to the old IPCs, and the cases occurring after 1st of July 2024 are as per the BNS of 2023. Now, for the cases occurring before 1st of July 2024, the cases were correctly filed under 304A and mischievously by the police under 304 Part 2. And you have to understand the difference here. 304 Part 2, which was used, which was being rampantly used by the police mischievously, are the typical Salman Khan case where he was drunk and he was driving and he killed people on the footpath. Now, you have to understand that on three headings: conduct, intention, and knowledge. Was there conduct? Yes, there was a conduct. He was drunk and he was driving and there was death. Was there any intention to cause death? No, he had no intention to kill anyone. But was there knowledge? Yes, everybody knows that if you're drunk and if you drive, there is a possibility that you might kill someone on the footpath. For this, it is non-bailable. That means the bail cannot be obtained in the police station. The bail is obtained from the magistrate, and the punishment is maximum 10 years and or fine. As against that, the correct IPC for the doctor's medical negligence is 4A, where there is conduct. Yes, you did some surgery, you gave some treatment, and there was death. Fine. Is there any intention? Is doctor intending to cause death? No. But does the doctor have knowledge? Now here is where the police is to catch you. आप तो डॉक्टर है, आपको तो सब समझता है कि ये ट्रीटमेंट से पेशेंट मर सकता है. Now get arrested under 304 Part 2. But having knowledge and being knowledgeable, because you're a doctor, being knowledgeable about the anatomy and physiology are two different things. And this is where we had to explain the police that this is different, and doctors have to be arrested if at all for medical negligence under 304A. And the good thing is it is bailable, which means the bail will be given to police itself in the police station. यानी आपको रात police station में arrest होके रहने की जरूरत नहीं, and the punishment is maximum 2 years and or fine. And Dr. Naurangi has left actually, but let me tell you, in Pune, it was Dr. Naurangi who has battled us several times with the police to explain to them that the doctor should have been arrested under 304 Part 2 and not under 304 Part 2, but under 304A. And I'm sure Girish must have done the same thing in Solapur. And there are many medical legal experts all over the country where people were helping our people, our doctors, not to get arrested under 304 Part 2, but under 304A. But when the BNS was being drafted, we doctors were waiting for some good news coming from the government. And on 20th of December 2023, our Home Minister in the Lok Sabha said, currently, if there is a death due to akin to murder, therefore, I will bring an official amendment to free the doctors from any criminal negligence. And we were very happy. To an extent, the doctors were so happy that the Delhi IMA gave an advertisement thanking Amit ji for decriminalizing medical negligence. But very soon we realized that this was just another jumla. Because if you read with me this. I mean, this may be a little busy slide, but first of all, you read with me, and then we'll decode this, whatever we are going to read in the next slide. It says, 106.1 says that whoever causes death of any person by doing a rash or negligent act not amounting to culpable homicide, then there is an imprisonment for a term which may extend to 5 years and also be liable to fine. But if it is a medical negligence done by a registered medical practitioner, then it is 2 years and a fine. So see, 1061 says that if it is negligence done by a registered medical practitioner, then it is not 5 years and fine, it is 2 years and fine. And RMP is defined as the one who has medical qualification recognized under NMC Commission Act of 2019 and whose name has been entered in the National Medical Register or State Medical Register under the Act. Now we will decode it. Once you decode it, you will understand that medical negligence has not been decriminalized by the Bharatiya Nyaya Sanhita. 304 106.1 is almost the same as 304A for RMPs, which means it is giving us 2 years and fine, which was there in 304A. In fact, actually, it has become more severe because in 304A, we were talking about fine and or arrest. So we could get away with only fine. But here we are talking about fine and arrest. So now it has become a little more severe. And the BNS is totally unfair to Ayush because the definition of RMP, they say, is those under the NMC Act of 2019, which means the 2 years relief is only for the MBBS doctors. The Ayush doctors are still supposed to be punished for 5 years and fine in case of medical negligence wherein you cause death. So Ayush doctors will have to wake up because BNS is unfair to you. But despite these 2 points, if you want to count your blessings, then what has happened now that BNS has given us some respite because finally medical negligence has got codified under the BNS 106 Part 1. So the police can no longer play the mischief of booking under any other section but 106.1. Initially, they used to book under 304 Part 2. Now they cannot do anything because medical negligence has finally got codified. So this mischief that the police were playing all these years will now stop after the 1st of July 2024 for cases occurring after that time. So now we know that death due to rash or negligent medical act for MBBS is 2 years and fine. For Ayush, unfortunately, it is still 5 years and fine. Now, what about criminal negligence which causes injury? Not death, but injury. The injury can be simple hurt or a grievous hurt. And simple hurt means bodily pain or disease or infirmity. And voluntarily causing hurt involves intention and knowledge also. And for that, the punishment is 1 year or fine or maximum of 10,000, fine of maximum 10,000 rupees or both. But so, which means now you know that if you cause simple injury due to negligent medical act, then it is maximum of 1 year and or maximum 10,000 rupees. But if you caused grievous hurt because of your medical treatment, and if you actually see the whatever has been enumerated as grievous hurt under section 116, then you will realize that any complication that occurs because of our treatment or our surgery can be considered to be grievous hurt. You just read it. It's a busy slide. I'll send the slides to you. But if you read this, you will realize अपने surgery करने के बाद भी कुछ भी complication हो, because the last point says that any hurt which endangers life or which causes sufferer to be during the space of 15 days in severe bodily pain or unable to follow his own ordinary pursuit. इसके अंदर सब कुछ आ सकता है. All complications of surgery. So you will be seen to have caused grievous hurt in every case, but it will be seen to have caused voluntarily a grievous hurt if they can prove that there is intention also and there was knowledge also, and the punishment is maximum 7 years and fine. But if the patient becomes permanently vegetative or patient gets permanent disability, then it is rigorous imprisonment for not less than 10 years, which may extend to even life. So now you know that grievous injury due to negligence, medical negligence, is 7 years, maximum 7 years and fine. And if you cause permanent vegetative state of the patient after, say, surgery or an anesthesia complication or a permanent disability, then 10 years of rigorous imprisonment, and it can be extended up to life. So ultimate gain that we have got today is that if you cause death due to medical negligence, for MBBS it is maximum 2 years and fine. For Ayush it is maximum 5 years and fine. But if you cause grievous hurt, then it is then 7 years and fine. And if the grievous hurt leads to permanent disability or permanent vegetative state, then 10 years of rigorous imprisonment and fine, which means there is less punishment for causing death and there is more punishment for attempting to resuscitate and save the patient. So I sometimes wonder, should I be resuscitating or should I be not resuscitating? That will be the question in my mind whenever I am treating a serious patient. If I resuscitate and the patient becomes permanently disabled, I'll have more punishment. But if the patient dies, I'll have less punishment. So this is the reason why I sometimes feel that law is an ass and some of the lawmakers are bigger asses than the law itself. So eventually, after understanding the BNS, the eyes of IMA are finally open now, and they have given our headquarters has given these letters to all the IMA of different states. And the gist of this letter is that IMA, all branches are supposed to begin a campaign so that the government will come out with a central act for violence against doctors, especially after the Calcutta incident. And they will see to it that medical negligence is decriminalized, because in every case of medical negligence, they should consider the section 26, which says that any act done in good faith and with valid consent where there was no intention to cause death, then there should not be any criminal medical negligence. So basically we are fighting for these two things, that the medical negligence should be totally decriminalized. So these were the sections which in the BNS which implicate us, but we should also know some of the sections which protect us. This is the slide. I'll send this slide to you across, because this is how are we going to be protected if somebody uses an abusive language against us, or somebody causes injury or hurt to a doctor or medical staff, or somebody gives a threat to the doctor, attacks a government doctor, damages the hospital, and so on and other things. So there are some of the sections in the BNS also which will protect us. We'll have to see those sections also as time comes by, and as more and more such webinars are conducted, we will go by all these sections and try to understand them as to how we are going to be protected by the Bharatiya Nyaya Sanhita. Then the next point is, doctors stock small quantity of drugs for use in his or her patient in his clinic or hospital. Now, does this amount to criminal negligence under the Drugs and Cosmetic Act of 1940? And the answer is no, it is not a contravention of the Cosmetic Act of 1940, but because the doctor is using it only for his patients and doctor is stocking small amount for his patient. But do we have some recent judgment, Supreme Court judgment as a case law to quote for this? And this is where you can quote, any drug inspector comes to you, you can quote this Supreme Court judgment, which has come only on the 15th of March 2023, wherein what happened was a Chennai drug inspector went to a dermatologist clinic and he found 18 medicines, mostly skin medicines, in that clinic. And the doctor was booked under section 27B2, read with section 18C of the Drug and Cosmetic Act. The section 18C says that unless you have a license, you cannot manufacture, stock, sale, distribute, or exhibit. And the section 27B2 says that if you contravene the section 80C, that means you do all that without license, then you can be booked for 3 years to 5 years plus 1 lakh or 3 times the value of the drug confiscated. But when this case went into the Supreme Court referred to the item 5 of the Schedule K of Rule 123, and this everybody should know. The rules came in 1945, which talks about what the doctor can do. And what the doctor can do is simply, doctor can supply medicine to his or her patients, her own patient, or to another RMP who can use it in his or her patient, and stock it in a reasonably small quantity, which means the amount of drugs you store should be reasonable, not a total stock of a lot of drugs. The RMP cannot open shop. So you cannot be seen as you have opened a shop in your clinic or sell the drug across the counter, and the RMP cannot import, manufacture, import or distribute or sell drugs. So this, if you follow this and if you keep a little stock of drugs in your hospital, then you can be saved, after quoting this particular case of Dr. Athi Lakshmi versus State of Tamil Nadu, which was fought in the Supreme Court. And the judgment came on 15th March of 2023. To end, I just wanted to talk a little bit about cross-pathy and criminal negligence. Because you know what, many of my BMS Ayurvedic friends say that they are now allowed to give allopathic medicine. So I thought I should spend a little time on this, because I am here not to help the BMS doctor. Because you have to understand, every pathy is governed by the respective council. Like the modern medicine, the MBBS are now going to be governed by the NMC or the MMC. The Ayush will be governed by the NSIM, NCIMS, that is National Council of Indian System of Medicine, and the Maharashtra chapter of it. Or the homeopaths will be governed by their respective council. And each council has got the locus to talk about the drugs under them. Like the modern medicine council, like the NMC, cannot say that you can use Ayurvedic drugs. Similarly, the Ayurvedic council cannot say that Ayurvedic doctors can use allopathic drugs. They can talk about only Ayurvedic drugs. And our NMC and MNC can talk about only allopathic drugs, and vice versa. But my BMS friends in Maharashtra feel that they are allowed to prescribe allopathic drugs, because they say that the MCISM under the Maharashtra Medical Practitioner Act amended the section 25 in 2014, and they say that they are allowed to practice allopathic medicine. This is what they have to say. But I always say that even if they have this as an argument, this argument is on a slippery slope. Try to understand what the amendment says. This is the Maharashtra government notification which came on the 26th of June 2014, and the notification was about the amended section 25 of the Maharashtra Medical Practitioner Act. This act is about Ayurvedic doctors. This act is not about allopathic doctors. And they say that the Ayurvedic doctors can prescribe allopathic medicine to the extent of the training they received in that system. This argument cannot stand the test of Supreme Court as per the Mukhtiar Chand case, because MCISM can decide only about Indian medicine. They can talk about who cannot write Ayurvedic medicine or Unani medicine. They cannot mention about who can write allopathic medicine. So they can not tell their Ayurvedic doctors that they can write allopathic medicine. And even if they say, their name has to get registered in the state medical register of the Maharashtra Medical Council to be allowed to write allopathic medicine. So Ayush doctors actually are on a slippery slope, but these Ayush associations should learn from Homeopathic Association in Maharashtra, because the 2014 amendment of the Maharashtra Medical Council, which is the correct council, which is the council which governs allopathic medicine, they said, the MMC said that if they do a recognized certified course and their name is entered in the state register of the MMC, they will be allowed to prescribe allopathic medicine. So Ayush doctors should learn from the Homeopathic Association. And if the Ayush doctor feels that ये तो ठीक है, लेकिन केस जाने के बाद देखेंगे, so here is a case which is a Supreme Court case of 14th of June 2023, wherein a BMS doctor had given allopathic drugs with steroids for 8 to 10 months to a case of active vitiligo, and unfortunately the patient had cataract and herpes. The doctor's doctor was from Haryana. Haryana had similar notifications which came from Maharashtra. So the doctor produced those notifications, but the judgment awarded 5 lakh rupees. Fortunately, no criminal liability, and they referred the Mukhtiar Chand versus State of Punjab case. And this Haryana Medical Education's Ayurveda department, the Supreme Court says, has no locus standi to talk about allopathic medicine. So that is the reason why I always say my BMS doctors are under slippery slope. So they have to learn from the homeopathic colleagues who wish to prescribe allopathic drug. Do not draw swords against MMC. Do not suffer because of the fault of the Maharashtra government, that the Maharashtra government gave a notification taking help of a council of Ayurvedic. They should have given a notification taking help of MMC, which was the correct council to decide about allopathic medicine. Get amendment done by the MMC like the homeopath. Pass the certificate course like the homeopath. Get your name registered in the state medical register of MMC. Otherwise, you will be on a slippery slope and you will be considered to have done negligence per se, and that can attract criminal liability for forgery, which is up to 2 years also. So, also, there is an advice for our allopath friend: do not prescribe Ayurvedic drug or homeopathic medicine. You are also not allowed to prescribe Ayurvedic or homeopathic medicine. Then, if you do that, and there are so many galactogogues that we prescribe. There are so many. We leave 52 is one thing that we prescribe left, right, and center. So that you will be considered to have done negligence per se, and that can attract even arrest. I thank you very much for a patient listening, and those of you, again, I always take this as an opportunity to advertise the new business that I've started at Usphere, where we help you commission your own brand of IVF center if anybody is interested in doing that. Thank you very much for a patient listening, and if there are any questions, I'm ready to take, and I'm sure Girish will have a lot of inputs to give.
No, input, yes, not mistakes. I cannot point out mistakes. No, input, I will give 1 or 2 inputs, Dilip, definitely. As you said, the resuscitation measure, is it punishable if it causes a grievous hurt? Well, this is an act done in emergency without any consent in good faith to save the patient. So the section 30, previously section 92 of IPC, and now section 30 of BNS is going to save us because this act was done in good faith. So that should not, that misconception we need not create fear by if I resuscitate a patient goes into vegetative. No, I think will not be punishable under that. Rest of the things you have explained so nicely, Dilip. I don't think anything extra is needed. You have rightly pointed out the problem of Ayush doctors because they have been deceived by the government of Maharashtra, and that's unfortunate. So we must.
And we always thought this government is very pro Ayush doctors. We always thought that, but now the Ayush doctors should realize that everything was a jumla eventually.
And as you pointed out, actually the BNS has made no difference to IPC except that certain clauses, certain unwarranted things have been removed. The section numbers has been brought down, but essentially the whole crux of the BNS is similar to IPC. They cannot change it, of course. It has to be a penal code anyway. But simplification is there. New things have come up. LGBTQ community has been given a lot of reprieve. And as you said rightly, medical practitioner, by including as a medical practitioner, police have been tied down. That's a good thing you have pointed out. That's an excellent lecture deliberation, Dilip. I must congratulate you for that. And thank you, organizers, for giving me the opportunity to chair session of my friend Dilip. That's it. Thank you.
Varsha has a question, I see.
Yeah, I do not have a question.
Varsha, काहीतरी difficult question नको विचारू.
No. I will just comment on your topic. It was excellent and very crystal clear what you have written, what you have delivered. I want to just tell you one thing that whatever small quantity of medicine you are keeping in your hospital should be displayed, or आता काय झालंय गव्हर्नमेंट मध्ये we are on the e-औषधी. So everything medicine which comes into the in-house, कुठून आलं, काय आलं, केव्हा आलं, एक्सपायरी, त्याची ड्रग, डेट ऑफ मॅन्युफॅक्चरिंग, कुठला everything is displayed. So we have digitalized in government. So I think we should also improvise keeping our inventories properly in our hospitals.
Yeah, the Drug and Cosmetic Act talks about a register, but register maintain करणं तुला माहिती आहे tough असतं. So if it is a computer, I mean, most of these pharmacy people have a software. So you can always borrow a software from those pharmacy guys, wherein सगळं येतं त्याच्यामध्ये. तू जे म्हणालीस ते मॅन्युफॅक्चरिंग डेट, द एक्सपायरी डेट आणि कधी परचेस केलं काय.
करेक्ट. आणि पुण्यामध्ये प्रॉब्लेम झाले. आय थिंक 4-5 हॉस्पिटलचे, क्लिनिकचे कॅन्सलच केले रजिस्ट्रेशन्स. दे आर इन ट्रबल. म्हणजे
आता बिकॉज ऑफ दिस रिसेंट जजमेंट आपल्याला हे जजमेंट दाखवून त्यांना सांगता येईल की बाबा मी रिझनेबल क्वांटिटी ऑफ ड्रग्ज, आता रिझनेबलचा अर्थ काय, आपण काय पाहिजे ते लावू शकतो. पण समजा इफ यू आर हॅव एन IVF सेंटर अँड यू आर डुईंग 25 सायकल्स इन अ मंथ, तर समथिंग वर्थ दॅट यू कॅन गिव्ह टू 50 पेशंट्स, यू कॅन लॉजिकली से की माझ्याकडे 25 सायकल होतात, 50 सायकलचा स्टॉक माझ्याकडे असायला पाहिजे ना. सो
exactly.
लॉजिकल.
So you have to go through that trouble if your license get cancelled ना. प्रोसिजर तुम्हाला फॉलोच करावी लागणार आहे, की कुणाकडे जा, परत ते अपील करा, अपील टुवर्ड्स द मंत्री, व्हॉटएव्हर, हे सगळं आलंच परत त्या चक्रव्यूहात. तेव्हा मला असं वाटतं की सॉफ्टवेअर कोणीतरी जे काही औषधीचं आहे तेच परत खाली सगळ्यांना देऊन अपडेट करावं, सो दॅट यू आर ऑल सेफ ऑन पेपर.
May I have one point?
Yeah, Sudesh.
Dilip sir. Yes, yes.
Please.
About the amount of stock. As far as the law goes, there is no limit for the amount of stock which a doctor can stock. Law मध्ये कुठेही अप्पर लिमिट दिलेलं नाही, पहिली गोष्ट. दुसरी गोष्ट, about keeping or dispensing the medicines. तुम्हाला जे रजिस्टर ठेवायचंय, that is only meant for Schedule H and Schedule X drugs. तुमचं आयर्न आणि कॅल्शियम शेड्यूल H मध्ये येत नाही, त्यामुळे त्याचं रजिस्टर ठेवायची गरज नाही. तुमच्याकडे त्याचं बिल असलं पाहिजे. डेफिनेटली ते आपल्या सगळ्यांच्याकडे असतं. आपण कुठं चोऱ्या करून किंवा स्मगल करून आणत नाहीये. आपल्याकडे जो इन्व्हेंटरी आली त्याचं बिल तुमच्याकडे काय, त्या बिलावर तुमची मॅन्युफॅक्चरिंग डेट, एक्सपायरी डेट सगळं आहेच. आणि नुसतं आयर्न कॅल्शियम सारख्या गोष्टी जर तुम्ही डिस्पेन्स करत असाल तर त्याचं शेड्यूल के मधलं जे पुढचं रजिस्टर आहे, कुणाला दिलं, किती राहिलं, हे ठेवायची गरज नाही. शेड्यूल H, शेड्यूल X ड्रग्ज आहेत, त्याचं रजिस्टर ठेवलं पाहिजे. परंतु जे शेड्यूल H मध्ये ड्रग्ज नाहीत, आयर्न कॅल्शियम सारखे फूड फॉर्टिफिकेशन मेडिसिन्स, ते शेड्यूल H मध्ये येत नाही. त्यामुळे ते तुम्ही डिस्पेन्स करू शकता. त्याचं वेगळं के रजिस्टर आणि त्याचं डिस्पेन्सिंग रजिस्टर ठेवायची गरज नाही.
करेक्ट. त्यांनी स्पेसिफिकली या कॅटेगरीच्या ड्रग्ज साठीच रजिस्टर सांगितलंय. फक्त एवढं करा की डोंट बी सीन ॲज इफ यू हॅव अ शॉप. आपण काय करतो, आपल्या इंटिरियर डिझाईन मध्ये ना एक असं काहीतरी डिझाईन करतो की तिकडे एक विंडो आहे, त्याच्या मागे एक माणूस बसलेला असतो, तो ड्रग, हे करू नका. तुम्ही तुमच्या सिस्टरच्या थ्रू ते ड्रग द्या आणि मग त्याच्यात बिल लावा किंवा तुम्ही बिल करेक्ट करा. परंतु डोंट अपियर ॲज इफ यू हॅव ओपन्ड अ शॉप विदिन युअर क्लिनिक ऑर विदिन युअर हॉस्पिटल. कारण या जजमेंटमध्ये 2 गोष्टी लिहिल्यात. द डॉक्टर हॅज नॉट ओपन्ड अ शॉप, नंबर 1, अँड द डॉक्टर हॅज अ रिझनेबल अमाऊंट ऑफ स्टॉक. त्यांनी खूप स्टॉक. आता रिझनेबल या शब्दाचा अर्थ काही असू शकतो सुदेश. तो रिझनेबल म्हणजे 100 पण इंजेक्शन असू शकतात.
50 पेशंटची ओपीडी आहे, महिन्यात मी 1500 पेशंट बघतो, मी आयर्नचे 100 बॉक्स ठेवू शकतो.
करेक्ट. परंतु जेव्हा ते ड्रग इन्स्पेक्टर येतात त्यांच्याशी शेवटी नीट बोला, त्यांना
नम्रतेने, ते सासू सारखे असतात, त्यांच्याकडे
मला जे सांगायचंय तुम्हाला कळलं.
व्हेरी लिनियंट. तुम्ही त्यांना कायदा दाखवला की ते तुम्हाला त्रास देणार.
म्हणजे त्यांना नमस्कार करा, बसा, चहा पाजा.
You are in a government authority position. You are on the maybe you are on the other side, but you are equally on the fence.
वर्षात तुझ्यासारखी कोणी आली तर मग चांगलं आहे, पण दुसरं कोणी आलं तर ते टफ असतं. वर्षा, तुला माहिती आहे.
व्हेरी ट्रू.
You are on both sides of the table, Varsha.
Being on the position and
आले ना,
doing that.
विचारतात
काय सर?
के रजिस्टर विचारतात ते तुमच्या ड्रगचं.
माने सर टेबलच्या दोन्ही साईडला, तिकडे एक आणि तिकडे एक.
त्यांनी के रजिस्टर विचारतात, आपण के रजिस्टर मेंटेन करायला पाहिजे, म्हणजे मग त्यांना बोलायला चान्स राहतो.
कसं आहे, सुदेश म्हटल्याप्रमाणे कायद्याने आपल्याला के रजिस्टर सगळ्याला मेंटेन करायची गरज नाही. पण मला वाटतं आपणच आपल्या फायनान्शियल किती आले, किती पैसे आले, किती गेले, ह्याच्यासाठी आपण आपल्या सगळ्यात, इव्हन तुम्ही आयर्न कॅल्शियमच्या टॅबलेट जर घेतल्या असेल तर त्याचं रजिस्टर ठेवायला काय जातं. ऑलवेज बेटर टू हॅव दॅट रजिस्टर. आणि तुम्ही दाखवा त्यांना की हे बघा मेंटेन केलंय.
I know Sudesh's tailor-made software. I have seen it.
I know.
Very
Sudesh, if you really have a software, त्याची एक ऍडव्हर्टिजमेंट सॉर्ट ऑफ तू या आपल्या सगळ्या ग्रुपवर पाठव, कारण दिस इज इम्पॉर्टंट. आपण मेडिको लिगल बद्दल बोलतो, पण त्याचे सोपे सोल्युशन जे आहेत ना, ते आपल्या बऱ्याच मित्रांनी प्रयत्न करून काढलेले आहेत. ते सोल्युशन तुझ्याकडे असेल तर ते दे सगळ्यांना.
Sudesh has revealed one secret to all, I think, to me, that his inventory is managed by his father till date. So he's not worried about it.
Managed by who?
His father.
No, he doesn't manage my inventory. He manages my accounts. He manages my accounts.
हे बरं आहे की फादर मॅनेज करतात, बायको मॅनेज करत नाही.
Thank you, sir. Thank you for the very nice talk, sir. Thank you so much.
Thank you, Suyogam, for giving me the
Only at the
opportunity.
end, only at the end,
have
I must appreciate Girish's comment, wherein please, for God's sake, don't go back with this carry over message की आपल्याला जर पेशंट सिरियस असेल तर त्याला रिससिटेट करायचं नाही, मरू द्या त्याला, असं प्लीज करू नका. आपण त्याला रिससिटेट करू, आपण त्याला बाहेर काढू, कारण त्याला बाहेर काढल्यावरती गिरीश सारखे लोक आहेत, अमित कारखानी सारखे लोक आहेत, दे विल सेव्ह यू. सो फर्स्ट आपली ड्युटी इज टू सेव्ह द पेशंट वॉट एव्हर इट इज. ती परमनंटली व्हेजिटेटिव्ह झाली तरी पण यू ट्राय अँड रिससिटेट द पेशंट. कायदा गाढव जरी असला तरी आपण गाढव नाही आहोत, आपण आपलं काम करायचं आणि आपले मित्र आहेत आपल्याला सेव्ह करायला. सो माझं जर कॅरी ऑफ मेसेज काही चुकला असेल तर म्हटलं पहिलं ते ओके करूया.
शेवटचा अतिशय पटला.
Thank you, Dr. Dilip Parke, sir, for the excellent presentation. Thank you all the chairpersons for your valuable inputs. Now we are moving to last session of the webinar, that is panel discussion, reverse panel. I'll request convener Dr. Suyoga Panat ma'am to to take over.
Yes.
You have to leave. Sorry, I have
Vishal,
to leave
can
to
we have the
another
slides,
webinar.
please?
Thank you so
Vishal?
much. Yes. Actually, this panel is on reverse panel on dilemma of medico-legal issues. And we had Amit Karkhane sir, who was supposed to moderate and who was supposed to give his expert comments, but he has some family emergency and his wife is admitted at Apollo Hospital just half an hour by. So he is unable to join, but Dr. Girish Kumtekar sir, Dr. Varti sir, and Dr. Sudesh Doshi sir are here to answer all the queries. And I would request all the panelists to address the questions to these three medico-legal stalwarts so that we can have a very good interactive panel discussion. So next slide. Ranjan, can we introduce the panelists in short? Yeah. We have 6 panelists: Dr. Vandana Sangale, Dr. Asha Nikte, Dr. Prajakta, Dr. Kavita Kamble, Dr. Swarupa Iyer, and Dr. Saili Jagedar. I would like to introduce them in short introduction. Next slide, please. Dr. Vandana. We have Dr. Amit Karkhane sir, who was supposed to be here. He has a huge experience of 20 years in medical legal practice, but unfortunately is not here. Maybe next time we will have the privilege of having him with us. Next slide. Next slide. Yeah. Dr. Vandana Sangare, she's MBBS MS, has done fellowship in reproductive medicine, ultrasonography and laparoscopy, and she's a practicing obstetrician and gynecologist, infertility specialist since 12 years, and she's from Nashik, and she's an active member of PAC, Amogs, as well as FOXY. Next slide. Dr. Asha Nikte from Apollo OBGY Society. Again, she is PAC in charge for state. She has worked in government hospital for 9 years, and she has a personal maternity and sonography hospital. She is an active member of Apollo OBGY Society as well as Apollo IMO. And she has received the Lokmat Sakhi Puraskar in 2017 in Health Amogs PAC Champion Award in 21-22. Next slide. Dr. Prajakta, we have recently seen she has organized a great conference in Udgir. She is the director of Mahir Maternity Hospital and Nucleus Rescue Baby Center at Udgir, with special interest in infertility. And she's trained in infertility, ultrasonography, endoscopy, and colposcopy. And she has attended many state and national level conferences and has 3 publications in international journal. Next slide. Dr. Kavita Kamble, she has done MBBS from Pravara Medical College and DGO from Mumbai University and practicing as a high-risk obstetrician and gynecologist since last 15 years at Krishna Cardiac and Maternity Care Center. And she is the director of...
आल्यानंतर मला त्यांच्याकडे सर्टिफिकेट देत आहेत सगळं बघून. प्रत्यक्ष मला त्यांना द्यावं लागेल.
Okay. She has
हो,
been the
त्यांच्याकडे
awardee
देते. मला
of
दुसरं
Idol of
कोणाकडे नाही
Maharashtra
सोपवत.
from
ते आल्यानंतर
Sakala
त्यांच्याकडे
Samuha
देतो.
and awarding
तर
many
तुम्ही
awareness
अशी एखादं
campaigns
कागदपत्र
at
एखाद्या
schools
व्यक्ती
and
दुसऱ्याकडे
colleges.
नाही देऊ शकत, त्यांना येऊ द्या.
Next slide. Sir,
सुदेश
तुमचा
म्यूट कर. सुदेश
phone
म्यूट
सुरू
कर.
आहे.
असं नका.
सुदेश म्यूट कर.
We have another consultant obstetrician, gynecologist, and fertility specialist and medical legal advisor, Dr. Swarupa Iyer. She is secretary of Thane OBGY Society, member of Ethics and Medical Legal Committee of FOXI, and peer reviewer for Journal of OBGY of India, and part of legal team of Apex Insurance. Next slide. She is my friend, Dr. Saili Jagirdar, associate professor at PDMMC Amravati. She is member of FOXI and IMA and ISOPAR. She was clinical secretary of Amravati OBGY Society, and she has received the late Shailaja Chaudhary Award for Academic Excellence in 2018. She has written chapters and textbooks as well as research articles and case reports, and she has special interest in critical care, obstetrics, and high-risk pregnancy. So, next slide. I hand over the questions to the panelists, and we have Dr. Sudesh sir. Just a minute. Yeah. Question number 1.
अभ्यास करायला पाहिजे थोडासा. अवघड आहे. Is the Consumer Protection Act
Any
applicable to
panelist
medical?
can ask this question. Yes.
So, Sudesh, are you answering?
आधीच एक डिस्क्लेमर दिलंय की आय एम नॉट अ लॉयर. त्यामुळे आपल्या याच्यामध्ये लॉयर दिसत आहेत एक गिरीश कुमटेकर सर. हे हे लीगल जार्गन्स आहेत. हे त्यांच्याकडनं समजून घ्यायचं आणि आपण सोप्या भाषेत ते बोलायचं. त्यामुळे गिरीश सर तुम्ही हे सांगा, हे सगळं लॅटिन आहे आमच्यासाठी.
Yes, basically the Consumer Protection Act is applicable to medical profession. There's no question about it. BP Shanta versus IMA case was decided in favor of consumer, and doctors are service providers and patient is a consumer. There is no question, second doubt about it. About negligence per se, these are two the maxims, they are called in the legal language. Negligence per se means negligence which does not need any proof. That means leaving a mop in the abdomen, leaving a scissors in the abdomen, artery forceps in the abdomen. You don't need any proof for that. And that is called as negligence per se. And it is definitely punishable, and we don't have to prove anything against the doctor. The consumer doesn't have to prove anything if there is a negligence per se. There are a lot of
गिरीशरांचं नेटवर्क गेलं होतं.
As network issue खूप आहे. Panelists are there, right? Panelists are there.
Yeah.
Yes.
Yes.
Sudesh sir, you can take over.
रिस्क एप्सिलॉन लोकेटर म्हणजे जे आहे ती वस्तुस्थिती त्याच्यासाठी बोलते, वेगळं दाखवायची काही गरज नाही. जसं आता सर म्हणत तसं रिस्क एप्सिलॉन लोकेटर म्हणजे बाबा समजा तुमच्या उजव्या हातावर आपल्याला काही सर्जरी करायची होती आणि तुम्ही डाव्या हातावर सर्जरी केली, ती उजव्या डोळ्याची सर्जरी होती आणि डाव्या डोळ्याची सर्जरी. द थिंग स्पीक्स फॉर इट सेल्फ, वेगळं दाखवायची काही गरज नाही. दॅट इज रिस्क एप्सिलॉन लोकेटर. हे असं समोर असेल तर मग परत वेगळं काही प्रूव्ह करायची गरज लागत नाही. कंझ्युमर प्रोटेक्शन जर असेल किंवा कुठल्या लॉ मध्ये असेल तर ज्या माणसाने तुमच्यावर आरोप केलेला आहे मग तो आरोप प्रूव्ह करण्यासाठी त्याला वेगळं काही करावं लागत नाही. जे समोर दिसतंय ते स्वतःसाठी बोलतंय. दॅट इज रिस्क एप्सिलॉन लोकेटर.
Any other inputs on this, or we can move ahead with the next question?
थोडक्यात आपल्याला या सगळ्या लीगल लोकांकडनं एवढं कळलं की या ज्या केसेस असतात की ज्याच्यामध्ये इट इज ऑब्वियस की नेग्लिजन्स झालाय, अशा केसेस आपण कृपया ह्या आपण हे करायचा प्रयत्न करा. म्हणजे यू ट्राय टू सॉल्व दिस केस आउट ऑफ कोर्ट.
गिरीश सर, अनम्यूट युअरसेल्फ. गिरीश सर तुम्ही म्यूट राहा.
मी म्यूट आहे. अच्छा, गिरीश sir आले का?
गिरीश sir.
Mute
Alex,
होतो मी.
sir.
Okay, fine.
Okay.
So I think you got the answer because I was locked up because of net problem. But
yeah,
the evidence shows that the OT is ill-equipped, there is no oxygen, and all these things. So it is res ipsa loquitur. The facts speak for themselves. Next.
Next question, please. Dr. Asha madam is going to ask this question. Dr. Asha ma'am, are you there? Asha madam?
Any panelist can ask.
Yeah, Kavita, you can take this, please.
Yeah. So there's this question all now. We had a discussion right now, we can keep the drugs or not. So according to that, what are the rules regarding keeping and dispensing the drugs as per the Drugs and Cosmetic Acts? So if you could tell more about it, it would be helpful.
I think it was elaborately told by Dilip in his own lecture
Yes.
now, just before,
Yes.
just 2 minutes back.
Yes,
So
yes,
you
it
can,
was discussed.
even one of the
we can
panelists can revise it if he has listened intently.
So only salient points who have joined, for people who have joined late. Only salient points are
नाही
left.
नाही अगदी सोप्या भाषेत सांगायचं म्हणजे यू कॅन कीप इट, you can keep reasonable amount of drugs, only you have to prove that you are using it for your own patients or you're using it to give it to some other RMP who's going to use it for his or own patient. तुम्ही ते तिकडे तुमच्या हॉस्पिटलमध्ये you cannot open a shop where you will sell this drug and stock it in a large amount and sell it. So if you can prove that you have got reasonable quantity, like you've got some drugs in the operation theater, you've got some drugs in your wards, that you can always keep, and you can even charge for it when you give these drugs to the patients. So this is loud and clear, and if you want any case law, my presentation.
Sir, I have one question.
Yes,
so recently in Karmana, we had this search for injection termin, that the people were keeping termin outside of hospital use. But then we had a search in our hospitals also, and we were warned to keep the injection termin to be safely. So how could
त्यांना हेच तुम्ही हा जो सुप्रीम कोर्टचं जजमेंट आहे हे त्यांना प्रेमानं समजून सांगा की बाबा वी हॅव बीन अलाउड टू कीप दिस ड्रग्स, आणि हे जजमेंट त्यांना दाखवा. या जजमेंट हे जे जजमेंट मी तुम्हाला कोट केलं ना, यू विल गेट डाउन, यू कॅन डाउनलोड इट फ्रॉम द इंटरनेट. And this is, they have gone through every act of the Drugs and Cosmetic Act, every section of that act. आणि त्या सेक्शन मध्ये जर तुम्ही स्टडी केलं तर what Sudesh told us, and please Sudesh, you send us the software that you are keeping an inventory of the drug. That is going to help all of us. So if you do that, then I think this question will not arise.
Yeah, one more thing I want to make it clear. Yeah, one more thing on this thing. याच्यामध्ये जे म्हटलंय की ती डॉक्टरांच्यावर बंधन आहेत, याचा अर्थ असा नाही की तुम्ही तुमच्या दवाखान्यामध्ये एक ठराविक खोली डेसिग्नेट करून तिथं फार्मसिस्ट ठेवून फार्मसी शॉप तो फार्मसिस्ट रन करू शकतो. फक्त तुम्हाला फार्मसी शॉप रन करायला बंधन आहे. त्याचा उलटा अर्थ असा घेऊ नये की मी हॉस्पिटलमध्ये औषध दुकान काढायचंच नाही. हॉस्पिटलमध्ये औषध दुकान काढता येतं, त्यासाठी रजिस्टर्ड लायसन्स पाहिजे, त्याचा फार्मसिस्ट पाहिजे, त्याच्यावर बंधन नाहीये. कदाचित गैरसमज दवाखान्यात औषध दुकान काढायचंच नाही.
ऍब्सोल्युटली, यू हॅव मेड इट क्लिअर. कारण जर आपल्याला, कारण आहे ना, मी नेहमी म्हणतो, इफ यू हॅव अ फायनान्शियल विजडम, देन आपलं जर नर्सिंग होम सुरू झालं असेल, मोठं हॉस्पिटल, आणि तुम्ही 25-30 डिलिव्हऱ्या करतात, तर जेवढं तुम्ही तुमच्या हॉस्पिटलमधून कमवता तेवढंच तुम्ही त्या फार्मसीमधून कमवू शकता. So that's the reason why what Sudesh said is absolutely correct. You look out for some pharmacists, and त्या फार्मसिस्टच्या नावाखाली लायसन्स घ्या फार्मसीचं, आणि बिंदास 150 स्क्वेअर फीटचं एक फार्मसी शॉप उघडा आणि त्याच्यामध्ये पाहिजे तेवढे ड्रग ठेवा. मग तुम्हाला टेन्शनच नाही. So I think it is a financial wisdom to start a pharmacy shop in your nursing home, not on your name, but with a license that has been given to a pharmacist, not to you.
आणि सोपं म्हणजे भावाला द्या, आणि त्यापेक्षा उत्तम म्हणजे बायकोच्या भावाला दुकान काढून द्या.
किंवा अशी बायको बघा जिच्या भाऊ फार्मसिस्ट असेल.
आता कोण देणार सर, आपल्यासाठी दिवस गेले ना.
सर आम्ही खूप लेट झालो.
Next question, please.
Sir, I have one query. If we keep the drugs, do we need any license or just simply?
No. तेच तर एक्सेप्शन आहे ना, की फार्मसी ऍक्ट मध्ये कसे ड्रग अँड कॉस्मेटिक ऍक्ट मध्ये कुठलंही औषध मॅन्युफॅक्चर करायला, स्टोअर करायला, विकायला लायसन्स हवंय. पण डॉक्टरांना फक्त एक्झम्पशन दिलंय की तुम्ही मॅन्युफॅक्चर कडनं घ्या, सप्लाय कडनं घ्या, त्याचं बिल ठेवा तुम्ही, आणि कुणाला दिलं, जर शेड्यूल एच किंवा पुढचे ड्रग्ज असतील ते कुणाला दिलं याचं रजिस्टर मेंटेन करायला. आपल्याला लायसन्सची गरज नाही, परंतु तुम्हाला जर दुकान उघडायचं असेल तर दुकानसाठी लायसन्स लागतं. ते लायसन्स आपल्याला डॉक्टरांना मिळत नाही, ते फार्मसिस्टला मिळतं.
येस सर, येस सर.
Point made clear, I guess. We'll move
हा,
ahead
हा.
with the
एकदम
next
क्लिअर
question.
झालं.
Next question, please.
तर आपल्या इकडे सपोज
Yes.
फार्मसी आहे आणि फार्मसिस्टच्या नावावर लायसन आहे, बट वी कॅन बी अ प्रोप्रायटर अँड ओनर फॉर दॅट.
No, you cannot be a proprietor or owner of the shop. You can be a sleeping partner. तुम्ही तुमचं भांडवल गुंतवू शकता, पण प्रोप्रायटर तुम्ही त्या शॉपचे ओनर होऊ शकत नाही. तुम्ही ती जागा त्याला भाड्याने द्या.
Okay.
ओके,
Next
मग आता
question.
सर
You cannot be a pharmacist and a doctor at the same time.
नो, आता माझ्या हॉस्पिटलमध्येच ते फार्मसिस्टला दिलेलं आहे आपण, बट द थिंग इज
See, there are two
प्रोप्रायटर
distinct entities. There are two distinct entities. One is the pharmacist who is running a shop, the license in his name, and the business. You can have a business MOU, memorandum of understanding with the pharmacist, that you are either 50, 20, 30% partner. But you cannot have your name on the license. You can become a business part of the pharmacist, but you cannot have your name on the license. You have to rent out. You have to rent out the premises to the pharmacist or the business enterprise you have opened up. That's it.
Giri, this is a very important question. का मी असं विचारतो
Yeah.
की a hospital can be owned by a non-doctor also. A
Yes.
person who is not a doctor can start a hospital and employ doctors who have got proper license to practice there, right? So
That's perfect.
similarly, I have a hospital. Why cannot I own a drugstore, keep a pharmacist, and take license under his name? So
You can do it. Of course, you can do it.
So आपण जे म्हणतो ना 30% किंवा 40% किंवा 50% याची पण गरज नाही. You can
No,
be a
it has to come on the
100%.
paper.
You can
It
be a
has to come on the paper.
100% owner of that pharmacy, but provided you keep proper person there in the pharmacy who's got a license. तर समजा मी गायनेकोलॉजिस्ट नाही आहे, मी सर्जन आहे. Can I not start a nursing home ज्याच्यामध्ये एक MTP center आहे? I can
Of
do
course
it. I
you
can
can.
be an owner,
Yes.
but the MTP will have to be performed by a person who is a registered medical practitioner as per the MTP Act. त्यामुळे आपण
Perfect.
ओनर होऊ शकत नाही का? आपण ओनर होऊ शकतो. सुदेश, इथे
याच्यामध्ये
थोडासा
बरं का?
डिफरन्स ऑफ ओपिनियन आहे, पण सुदेश यू
नाही.
हॅव टू अंडरस्टँड.
याच्यामध्ये मी सांगतो काय झालं. मध्यंतरी एका ठिकाणी एका डॉक्टरांना स्वतःच्या हॉस्पिटल मेडिकल स्टोअर चालू करायचं, स्वतःच भांडवल घालून. तर तो जो ड्रग इन्स्पेक्टर आलता तो म्हणाला आमच्या बाजूने तुम्ही दुकान चालू करायला काय अडचण नाही, तुमच्याकडे फार्मसिस्ट एम्प्लॉय करायला प्रॉब्लेम नाही, पण तुम्हाला अडचण येते आपल्या इथिक्स अँड मेडिकल आपलं जे आहे ना MMCचं आपण काय म्हणतो त्याला रूल्स अँड रेग्युलेशन्स, त्याच्यामध्ये आपण म्हटलं की रिकॉग्नाइज द सर्व्हिसेस ऑफ द फार्मसिस्ट अँड डॉक्टर शुड नॉट ओपन अ शॉप. हे जे आहे ते आपल्या इथिक्स अँड रेग्युलेशन्स मध्ये आहे. बाकी कायद्याने तो म्हटलं की ड्रग ऍक्ट मध्ये जे आहे त्यात कुठेही असं नाही की डॉक्टर दुकान चालू करणे त्याची अडचण नाही, फक्त तुमच्या MMC कडे किंवा तुमच्या MCI कडे अडचणीत म्हणाला.
इन दॅट केस असं करायचं की आपण आपलं हॉस्पिटल आपल्या कुठल्या तरी रिलेटिव्हच्या नावावर करायचं आणि ती जी कंपनी फॉर्म कराल तुम्ही त्या कंपनीच्या ह्याच्यामध्ये एम्स अँड ऑब्जेक्टिव्ह मध्ये एम्स अँड ऑब्जेक्टिव्ह मध्ये वन थिंग इज दॅट यू विल स्टार्ट अ हॉस्पिटल अँड सेकंड एम अँड ऑब्जेक्टिव्ह विल बी यू विल स्टार्ट अ फार्मसी. असं करा.
सिंपल
or any other business.
start a medical store on name of your HUF.
Yeah.
In the
Yeah,
name
when
of
you
your
can do
HUF
that.
also. तुम्हाला भावाला बहिणीला मेहण्याला द्यायचं नसेल ना तुमच्या HUF च्या नावाने ते चालू करा, तुम्हाला पैसे तुमच्यात मिळत राहतात. एम्प्लॉय फार्मसिस्ट त्याला पगार द्या तरी चालतं, काय अडचण.
मला वाटतं फॉर अबंडंट कॉशन आपण आपल्या CS ला ह्याच्यावर विचारू, पण माझं असं मत आहे आणि गिरीश इज ऑल्सो विथ मी इन सेइंग दॅट यू कॅन बी अन ओनर, परंतु आपण कंपनी सेक्रेटरीला तरी फॉर अबंडंट कॉशन त्यांचा आपण सल्ला घेऊ बिफोर व्हेंचरिंग इन टू सच ऍक्टिव्हिटी.
त्यांच्या बाजूने अडचण नाही, अडचण आपल्या काउन्सिलची मेडिकल काउन्सिल ऑफ इंडियाची आहे.
मेडिकल काउन्सिलची
कोणी तक्रार केली तर.
अच्छा.
येस.
ओके.
पडदा खोलो. चौथा क्वेश्चन का?
Okay, next question. Prajakta, would you take it? Next question.
सर ॲलोपॅथिक आणि आयुर्वेदिक डॉक्टर्सने आता सरांनी सांगितलं ते थोडंसं इलॅबोरेटरी कॅन यू टेल की आयुर्वेदिक वाल्यांनी ॲलोपॅथिक द्यायचं आणि ॲलोपॅथिक वाल्यांनी आयुर्वेदिक मेडिसिन द्यायची.
मी आता आपल्या ह्याच्या आधी ना मी तुम्हाला होमिओपॅथिक वाले डॉक्टर ॲलोपॅथिक ड्रग्ज देऊ शकतात की नाही सांगतो. महाराष्ट्रामध्ये महाराष्ट्र मेडिकल काउन्सिलने स्वतः अमेंडमेंट केलंय आणि महाराष्ट्र मेडिकल काउन्सिल जे ॲलोपॅथिक ड्रग्जला गव्हर्न करतात त्यांनी लिहिलंय की होमिओपॅथिक डॉक्टर्स त्यांनी कोर्स केलाय ससून जनरल किंवा काही स्पेसिफिक ठिकाणी फार्मसीचा. हा तो जर केला असेल तर त्यांना ॲलोपॅथिक ड्रग्ज लिहायला परवानगी आहे. तर हे कोणी सांगितलं? एमएमसी. एमएमसी ॲलोपॅथिक ड्रग्जला गव्हर्न करतात. परंतु वेन इट कम्स टू आयुर्वेदिक डॉक्टर काय म्हणतात? आमच्या काउन्सिलने अलाव केलं, पण तुमच्या काउन्सिलला हक्कच कुठे आहे?
Yes.
Basically, this has become a game of words आणि महाराष्ट्र गव्हर्नमेंटने फसवलेले आहे आयुर्वेदिक डॉक्टरना. This notification by the government of Maharashtra will not stand the scrutiny of Supreme Court.
ऑल्सो म्हणजे महाराष्ट्र ऑल्सो. त्यामुळे मी नेहमी म्हणतो की वी आर महाराष्ट्र BMS पीपल आर अंडर स्लिपरी स्लोप. ते या भ्रमात आहेत की आपण ते करू शकतो, परंतु जर ही केस सुप्रीम कोर्टात गेली तर त्यांना प्रॉब्लेम होईल. त्यामुळे त्यांनी काय करावं? एमएमसी बरोबर प्रेमाचं नातं उत्पन्न करा. आयुर्वेदिक डॉक्टर भांडू नका,
सर्टिफिकेट
या
कोर्स करा.
आमच्याकडे. आणि काय म्हणतो सुदेश?
जसं होमिओपॅथी गेलं तसं एक सर्टिफिकेट कोर्स करा ना 6 महिन्याचा वर्षभराचा.
एक्झॅक्टली. फक्त एमएमसीनी तसं अमेंडमेंट करून लिहून द्यावं. एमएमसीच्या बरोबर हे लोक स्वर्ड्स काढतात, तलवारी काढतात. तलवारी काढायचे दिवस नाहीयेत. यू कम टू अस अँड वी विल अलाव यू. कारण आम्हाला माहिती आहे की वी कॅनॉट, there are not enough number of MBBS doctors in all the remote villages of our country, and we need the help of BMS doctor to prescribe allopathic drugs. We recognize that, and I think our MMC will not be so unkind to the Ayurvedic doctors that they will just not allow. असं मला वाटतं.
Can we prescribe Ayurvedic medicine?
We cannot unless some Ayurvedic council tells us that you are allowed to prescribe galactogogues. आपण जे वापरतो ना शतावरी, कल्प and फलाना and ढिकणा.
So if any reaction happens or something happens, so we are not supported in. So we are screwed.
हो, त्यामुळे आपणही लिहू शकत नाही. आपण ती रिस्क घेतो आणि लिहितो. कारण असंच लोकांना समज आहे की आयुर्वेदिक औषधांनी रिॲक्शन येत नाही. त्यामुळे ती रिॲक्शन आली तर तुमच्या सिटामॉलमुळे आली. आमच्या आयुर्वेदिक ड्रगमुळे नाहीच आली. त्यामुळे वी आर फ्री. बिंदास लिहा, काही होत नाही.
There are many cough syrups, sir, which are prescribed by allopathic doctors, or even uterine tonics are prescribed.
Let's just cut the thing short. Any Ayurvedic ingredients you are not supposed to read, that's final. मग हे कमी शतावरी देऊ का, मग कफ सिरप आयुर्वेदिक देऊ का, एलोपॅथिक देऊ का, that compartments are clear, and we should cut it short now, no problem. The things, the message is clear. Yeah, next question.
Yes. Message very clear, I guess. Next question.
Yeah. So this is another question. Like if a doctor.
Vandana is not. Okay. Yes, Kavita, please.
Can I take or someone else?
Yes. No, please take it.
So if a doctor is called for an expert witness, like an expert witness, whatever he tells, is that liable to the court, or can he be cross-examined, and would it be considered as a final point as he is an expert witness for that case?
Yes,
in cases of medical negligence.
Yeah, I would like to answer this question. The question is basically wrong. Is doctor has been called as an expert to decide liability for medical negligence? No, doctor is not to decide the liability. It's the court to decide the liability. One thing clear. Doctor is to explain whether there negligence is there or not. He's not there to decide liability. One thing very clear. Is the expert final authority, or can he be she be cross-examined? Yes, he is not the final authority. See, there are always 2-3 schools of thought and schools of treatment in our medical science. Medical science is not a perfect. But if an expert says that the school of line of treatment taken up by the treating doctor who has been accused of negligence is prescribed or has been decided, has been given in the books, textbooks, standard textbook, then it cannot be challenged. Why you should have used this cannot be dictated by the patient. I use this as per my science is the final thing. But when expert has to opine on the treatment by somebody accused doctor given to some patient and some mishaps have happened, the expert is only supposed to tell whether the treatment is standard or not. He is not there to tell this treatment should have been given. No, that is not accepted. Because the lines of treatment are always there. So the expert is the final authority. He can be cross-examined, but his opinion can rarely be challenged if it is based on a certain line of treatment prescribed in the textbook.
Yeah,
Dilip,
there
you
was
have something?
always this possibility. Can like most of the cases, they don't call for an expert witness. So this awareness should be there. Sometimes the whatever the medical witness, the expert witness tells, can it be used for the
Okay.
patient? Like, can be if there's a case on me, or for example,
Okay,
like
okay, okay,
negligence,
okay.
can
I
I
will tell
call
you.
someone for as an
Yeah, I
expert
got your
witness?
question. I got your
And
question.
yes,
One of the
most of the
Supreme
time
Court
we
and
don't
National
call
Committee.
for an expert witness. Yes.
I'll come to your opinion. See, one of the Supreme Court judgment went ahead to say that expert must be called in to substantiate accusations of negligence. But subsequently, this judgment was ruled out. So expert is not necessarily is to be called out. Another judgment came up. We said that even if the expert has given his opinion, it is not binding upon the consumer court. Now, this created a lot of dilemma. Whether I should give expert, is this the final opinion? No. Even if it is a final opinion, it is not binding upon the consumer court while deciding the liability or the quantum of punishment or the degree of negligence. That is very clear. So contradictory judgments came from Supreme Court itself that expert witness is a must, which was overruled by the another judgment later on, a decade later on. And later on again, National Commission itself decided that expert opinion is not binding upon us. You have to take your take.
Who
Thank you,
will
sir.
decide the expert, like कुठल्या डॉक्टरला एम्प्लॉय करायचं ऍज अन एक्सपर्ट?
It is usually the advocate on the both parties come to a one person who is a senior practicing in the probably in the same area, in the same specialty, of course. Other specialties cannot become an expert witness, but the name has to be agreed upon by two lawyers.
So there will be only one expert which will be agreed by both the parties. Or
Usually,
there can be
usually, or not necessarily the expert has to appear in the court. He can submit his opinion on a notarized affidavit also.
मला की गिरीश इथे एक तुला प्रश्न विचारत आहे. यू बिंग अ लॉयर, आय वॉन्ट टू आस्क यू वन थिंग. नाउ द क्वेश्चन विच कविता वॉज वॉन्टिंग टू आस्क इज, केस माझ्यावर झाली आहे, मला माझा एक्सपर्ट द्यायचा आहे. तो जो ऑपोजिट लॉयर आहे तो माझ्या एक्सपर्टला ऍग्री करतोय की नाही हा याच्याशी मला काही घेणं नाही. मला गिरीश माझा एक्सपर्ट आहे, कारण गिरीश माझ्या साईडनी बोलणार. त्यामुळे असं काही नाहीये की दोन लॉयर्सनी मिळून ठरवायचं याच एक्सपर्टला ठेवा, असं नाहीये. तुम्ही तुमचे पाहिजे तेवढे एक्सपर्ट द्या आणि म्हणजे एक दॅट इज युअर राईट टू गिव्ह युअर एक्सपर्ट. तो एक्सपर्टला कोर्टाने ऍक्सेप्ट करायचं की नाही हा कोर्टाचा प्रश्न. तो दुसऱ्या लॉयरनी ऍक्सेप्ट करायचा की नाही हा त्याचा प्रश्न नाही. दुसऱ्या लॉयर त्याला घ्यावेच लागतील. तर हे जरा त्याला कदाचित हे विचारायचं होतं की
आय एम नॉट टॉकिंग अबाउट रूल्स ऑफ एक्सपर्ट विटनेस. आय एम टॉकिंग अबाउट द कन्व्हेन्शन की इट इज युजली agreed upon by the both the lawyers. But you can have your own expert again.
आणि बहुतेक वेळेला त्या मेडिकल कॉलेजच्या प्रोफेसर्सना किंवा सिनियर प्रॅक्टिशनर्सनाच बोलवतात. आता दिल्लीत तर बऱ्याच वेळा एम्सच्या लोकांनाच बोलवतात.
अगदी अगदी प्रायव्हेटचं युजली बोलत नाहीत.
Okay.
Yeah, there is a difference between the court calling an expert and the difference between you giving an expert. See, you as a patient, as a doctor can give your witness, the relatives of or the patient can give his or her witness, and the court can also ask for the तीन ठिकाणाहून एक्सपर्ट्स येऊ शकतात आणि आपल्या एक्सपर्टने आपलं एफिडेव्हिट द्यायचं. मग त्याच्यानंतर कोर्ट ठरवेल तेव्हा या एक्सपर्टचं ऐकायचं का या एक्सपर्टचं ऐकायचं का कोणाचंच ऐकायचं हे कोर्ट ठरवेल.
नाही पण one thing I have to add there to this, Dilip, the court usually never ask for expert. They will never ask.
नाही काही केसेसमध्ये सुप्रीम कोर्टनी एम्स मधून एक्सपर्ट्स मागवलेले आहेत.
If there is a difference of opinion, there is a lot of ambiguity. They have a right to
ask for expert.
But on the per se, suo court will usually doesn't ask for expert.
एखादा जर गरीब रिलेटिव्ह असेल, गरीब पेशंट असेल, तो कोर्टात गेला, त्याला एक्सपर्टला कॉन्टॅक्ट करायला जमत नाही, तर ते कोर्ट कॅन स्टेप इन टू द शू ऑफ द पेशंट आणि त्याच्या बिहाफवर कोर्ट कॅन आस्क सम सिनियर डॉक्टर टू गिव्ह an opinion.
Yes. But then in such cases, court usually refers it to the district authorities.
Yeah.
Go ahead.
Can we take the next question?
Yes, please.
Next question, please. Sally has joined. Can you please take this question?
Sally or Swarupa, madam?
Yeah, should I ask
Yeah, Sally.
Suyoga?
Yes, ma'am, yes.
Yeah. So first of all, thank you, Suyoga, and I'm happy that I could attend finally. So thank you, Dr. Dilip, Dr. Girish, and Sudesh sir. I always learn something new after attending your lectures. The question is how it is awarded, but I think what they meant is how it is calculated probably if the case goes against employee. And if the compensation is to be paid, will the hospital pay if the case is against employee? So, and if you need to do a out of court settlement, how one can go for out of court? I mean, anybody can take Dr. Girish or Dilip sir or whoever.
Girish.
Okay.
आमचा representative Girish.
You know equally well, Dilip, I know that. See, the recent Saha case, in the Saha case, the Supreme Court has put down a formula. And now it is totally subjective how the court what's the compensation. It is totally subjective. Whatever the evidence of their income and all these things provided, the court might consider it against it. Usually, invariably, courts in these cases are always sympathetic with the sufferer, that is patient, and they are much against the doctors if the compensation is to be awarded. Majority of the cases are in favor of doctors. There's no question about it because it's very difficult to prove negligence per se or negligence, whatever it is, because it's the patient who has to prove the negligence and doctor doesn't have to prove the innocence. That's the basic difference between consumer case against the doctors. The patient has to prove negligence, which is very difficult with the help of all the armamentarium doctor has. But if a case comes to awarding a compensation, the courts are usually not sympathetic with the doctors. They will consider the financial situation, the age of the patient. There is a definite formula put down by the Supreme Court, which is not acceptable, which is very absolutely, absurd formula. It goes into crores of rupees, but
Especially patient is NRI, then you had it.
then it goes into crores of rupees. But usually what
Yeah.
the doctor considers, what the court considers is the patient employed. What is the possibility? Employment doesn't mean that home work or home keeping is also treated as employment, believe me. But what is the potential for that person in future? What is the longevity of the person that can be considered? And all these factors are considered. Annual income is computed and accordingly compensation is granted. It counts for inflation also. So the quantum is absolutely subjective, depending upon the suffering party, the doctor, and the lawyer. I mean the court. So there is a formula. You can refer to. I don't remember the formula
Yes.
exactly, but you can refer to the Saha case. Formula has been depicted in the judgment, but that formula is very subjective.
So just since we are talking about compensation, I have one question to all the panelists. Like suppose I have a professional indemnity of 50 lakhs and now I understand that it is quite less and I want to make it 1 crore. So instead of going to the same company, I take an additional policy from different company. And unfortunately, I land up in a actual medical legal suit and the compensation awarded to the patient is 1 crore. Now I have two policies of 50 lakhs, 50 lakhs. So will the company compensate individually or only one company will give 50 lakhs? Like how is it? How is it going to be?
I can take to both the questions, but before that, can I answer this question?
Yes, sir, please.
Yeah, first question is unanswered. That does the hospital pay for the compensation if the award is against the employee? Answer is yes. It's their vicarious liability. So first and foremost, you have to prove that you are an employee. It is not, this facility is not there for the visiting doctors or the panel doctors. That should be well understood. Number two, in turn, the hospital can recover from that employee by removing him from the duty, and whatever provident fund and all those things are there, they will stop all those things. So particularly government is expert in recovering the compensation paid on behalf of the government doctor. So they can attach the property as the dues of the revenue also. Now the question is about two companies giving indemnity insurance. First and foremost, that indemnity insurance must be effective on the date of happening of that case. So supposing
True.
50 lakhs you have got it from ICICI and 50 lakhs from say United, they will both give once one company is saturated. So supposing the compensation is 1 crore, you have coverage of 50 lakhs from each. Of course, there is an element of co-pay. So ultimately, see, insurance companies are very, very cunning enough that they are eager to collect the premium, but last months to settle the claims. So
Absolutely.
first company will give up to 50 lakh, up to the amount you are insured. And the second company will come into the effect after the first has paid. So whether you are claiming from United or whether you are claiming from ICI, it is up to you, which is your first company. So that way they will cover up to that extent. Supposing it is 1 crore 10 lakhs. So ultimately 10 lakhs you will have to give. So up to the
Okay.
amount of insurance they will pay. And third thing, I just wanted to add one more thing is the expert evidence. What the expert evidence goes in the criminal cases is from the government hospitals by and large. That is true. But that is a weak piece of evidence. So it is not that that is the final authority or final word. So that should be well understood every time. And one more caution that when you are giving the opinion of an expert from your side to defend your case, see to it that doctor giving that statement or opinion is agreeable to come for cross examination if required. I have seen several cases in which the doctors gave the opinion but did not come forward in the cross examination. वो बोलते हैं झंझट काय के लिए मांगता है, then it is a total flop. So we have to take an opinion from such a doctor that the person should be agreeable to come to cross examination if it is required. So these 2-3 points I wanted to make it clear. And
Yeah.
about the formula of compensation, most Sir Kunal Saha's case is an exception that they are given the huge penalty, huge, and it is also still under consideration because it has gone in front of the whole bench. It is not a final verdict. So that is recurring type of enhancement. But overall, they use the compensation formula, what is used in Motor Vehicle Act. And we have to plead one more thing, that please remember that these are not the healthy individuals. Uh, uh, an accident in an aeroplane crash, the person is by and large, very healthy, and he dies, and he has the full potential to go for the full service and all those. Whereas in these cases, the patient is a patient, he has come for some illness. So initially, his capacity to earn has already got limited. But that point has never been put forward by our doctors so far. So we can argue in multiple ways, but see to it that it is kept to a minimum. Ultimately, it is totally discretionary and it is totally to the whims of that judge at that particular moment of time when he's giving the judgment. Very arbitrary, very arbitrary. And secondly, we also are planning to put a PIL very soon regarding the amount of interest they are charging. If you don't pay in such and such time, it will be 12% interest, 16%. So how these are calculated, because the delays, the doctor is not responsible totally. In Kunal Saha's case, there have been conflicting decisions by the National Forum and then the Supreme Court, again the National Forum, again the Supreme Court.
Right.
So who is responsible for this delay? And the compensation interest amount is more than the actual amount of damages. So there are many aspects. We have to take it as a PIL. We are in that process right now.
Thank you so much, sir. It was really enlightening. Thank you so much.
Thank you.
Can we take the next question, please? Next and the last question.
Okay.
Yeah.
The laws. Good evening, all.
Hello.
Good evening. Good evening.
Good evening, sir. So, last question. What are the laws which protect a doctor from violence in view of the recent happenings that we have just seen? Sir, can you please highlight what are the laws which protect a doctor from violence? And also, please guide about the Nirbhaya Act 2013.
I think Dr. Walke is expert in this. Walke will answer.
Yes. Walke sir.
नाही सर तुमच्याकडनं ऐकायचं आहे. When you are there, I want to be a listener. Then at that time I am just a student.
Okay.
नवरंगे सर असताना मी स्टुडंट असतो. I am not.
असं काही नाही. Anyway, there is I don't know much about this Nirbhaya Act, but that is a workplace. No, sorry. Women's Protection Act, and Dr. Walke, I'm sure you will be competent to answer
Sir,
that.
that act is about women working in serving in a office or serving in a hospital, and त्यांच्यावर जे अत्याचार होतात. because she
Jayant, you
works.
tell about the enumerate the laws of protecting. I will talk something about Nirbhaya Act.
Oh,
Okay.
great.
Yeah.
So the law for protection of a doctor, right now 26 states have passed their anti-violence laws for the doctors. So we are trying to push forward for the central act, because unless it becomes a central act, the IPS course does not include that particular violence act. So therefore they are ignorant. Every time a commissioner comes, you have to go and give a copy and make them aware that there is such and such law. In Maharashtra, there is Maharashtra Prevention of Violence Against Medical Paramedical Personnel as well as medical establishment, that is clinics, laboratories, radiology places as well as hospitals. So that particular law is passed in 2010. Many times it is asked whether it is only a bill or law. It is a law. So it is very much in force. It is a 4-page law, and section 4 is quite important, that it gives what are the penalties for that. But right now what we have seen, only in 2 cases out of 126 enrollments, the cases have gone enrolled in Maharashtra state is 126. Whereas only in 2 cases, it could be concluded that Anti-Violence Act was applied, and the compensation and penalties and imprisonment to the persons who were nuisance creators have been put behind the bars. So it is practically a toothless law, and all the sections of IPC, I don't know the current sections of BNS, but the same things are there, creating at public place, nuisance about the public place, then creating nuisance to the other people surrounding, actually malhandling, all these things are there. So Violence Act is quite good in theory, but the practicality of it is very limited because they are gundas. And you are working alone. Alone means 10-20 people at the most. And other patients are also there. You have to take care of them. And at that spur of moment, if the police don't intervene and don't come in time, it is very difficult to protect against that particular mob. So mob lynching is also there. Damage to the property is also there. Destruction of your documents are there. Harm to the other patients is also there. So we want this to be a central law, that all police officers coming to the town and city are knowing about it. They don't require to be apprehended every time. And secondly, it becomes an effective law. The order has to come from the police commissioner to that particular, all the police stations under him. Now in Pune it has come. Luckily in Pune it has come after the violence at Pune hospital last month. So that, because they go by only office order. They call it DO, departmental order. So police will act only if the departmental order is there. So that we have to, all of us, get into touch with the commissioners and regional police chowkis and see to it that a departmental order is circulated from that district commissioner to all the local police chowkis. Then it is followed. So anti-violence law is there separate in Maharashtra, 26 other states, but not all the 33 states, and are not in the union territories. So it has to be a central law, and the case is going on in Bombay High Court from 20th of July 2020, on which I am one of the parties to that.
It was nice.
Thank you, sir.
Yeah. So I'll tell something about Nirbhaya Act and we'll conclude this already prolonged session. Okay, Nirbhaya Act was, as you know, it is basically criminal law amendment act. It's not a separate law by itself as a statutory law. It's an amendment act, and it was formulated in 2013 after the Nirbhaya case in Delhi. What it makes is, it makes the definition of rape much more elaborate than what it is in IPC. But the same has now been included in the BNS. So BNS is a lot of improvement in the IPC, and practically all the provisions from the Nirbhaya Act have been included in the BNS. But it makes the law definition of rape very elaborate. The criticism was that Nirbhaya Act doesn't talk about sex with wife without consent. Shall it be treated as a rape or not? But the BNS has elaborated on that also. So BNS has simplified a lot of things about offenses against women. That one thing. So Nirbhaya Act is practically going to be toothless, or it's not going to, it's going to be defunct once the BNS is implemented. It has already been implemented. It is it has increased the maximum sentence. And if there's a recurring act on the part of the accused, even after punishment, if there's a recurring act, death penalty also can be awarded for the crime of rape. That was what was included in the Nirbhaya Act. There are a lot of criticism also. There were basically Justice Verma formulated this act, and he tried to make many things simple and many things very favorable to the woman, and that's what the objection came. Nirbhaya Act is a gender biased act. What about male person? He has no protection at all. If the woman says it is done, it is done. There is no protection. So it was criticized. But these things, again, majority of them have been rectified in the BNS. So practically, 2013 Nirbhaya Act, though
सरांचं नेटवर्क गेलं का?
I think it has got hanged.
Network. Yes, yes.
Till the time he is audible, I will just add one more thing, is that there is, because of Nirbhaya case, important modifications in the Juvenile Justice Act have been made, and the age of criminal punishment in the same way the adults are punished is now brought down to the age of 16 instead of 18. So if it is a heinous act, then they can be tried from the age of 16 just like adults. That is what Nirbhaya Act has made another change in the IPC. But what sir was saying, I am not very aware about that. Rest of the things, yeah. But Juvenile Justice Act has been modified now. Because one of the culprits was 17 years and something. Just like that Porsche accident case in Pune, hit and run case. He's 17 years and 9 months. Now he should be, it's such a bad act that he should be tried like a criminal for as an adult age. Just few months down the line, he is an adult. So that amendment has been done. Any heinous act will be punished with 10 years rigorous imprisonment.
There is some network issue with
Yeah, Dr. Kumdekar.
yeah.
Yeah,
Kumdekar sir.
questions झाले का सुयोगा? Questions are
No.
over?
Yeah, these
Okay.
questions are over. If anyone has any other question, we can take.
आता सगळ्यांना
Very
भूक
interesting.
लागली असेल मला वाटतं. Yeah, so yeah, can we conclude?
Yes.
Yes.
Yes, yes.
You want to
नाही
add?
मी निघतो
Yeah.
आता मी नाही गेलो तर बायको मला
Yeah,
घरात
yeah.
येणार
Just
लगेच सकाळी 8 वाजता
let
आम्ही
me thank you.
अजूनही स्क्रब्स मध्ये बसले आहेत.
हो ऍक्च्युली वीकडेजलाच करा असं सगळे म्हणतात. सगळ्यांना सॅटर्डे संडे फ्री हवा असतो आणि लेट आवर्स मध्ये फॅमिली टाइम असतो. सो लाईक मल्टिपल प्रॉब्लेम्स. आय गेस आय जस्ट वॉन्ट टू थँक एव्हरीवन. आपल्याला खूप साऱ्या डिफिकल्टीज आल्या. वी हॅड टेक्निकल प्रॉब्लेम्स, वी हॅड नॅचरल कॅलॅमिटीज, पाऊस पडत होता, वी हॅड मेडिकल इमर्जन्सीज. I feel technology is a very good servant, but when it becomes a master, it's very dangerous, I feel. But in spite of that, we, with our persistence, perseverance, and coming up and helping each other, we have successfully and wonderfully finished this webinar. And I hope I'll be providing YouTube also later, and I hope there are a lot of take-home messages from this. And in spite of everything, I think the final outcome and output is really nice. And I want to really thank all the experts who have stepped in for at last moment. I know they do not need any preparation. So like we were fortunate, Suyoga, to have everyone on board.
Yes, definitely.
Yes, and I want to thank Sunita, our MOC today, to take out time and conducting this session, and not last but not the least, Core Connect for providing the platform. These guys they also tried, but there is heavy rains in Pune, I guess. So there's difficulty and technological problem. But thank you once again, everyone, and have a wonderful evening and nice day ahead. Thank you, Suyoga. Thank you.
Thank you. Thank you all.
Thank you. Good night, sir. Thank you, sir.
Good night.
Bye bye.
Thank you.
Thank you, sir.
Bye bye,
Thank
sir.
you.